Welcome to the joint meeting of everybody about South County EMS and then South County Senior Center. I'm going to start with the spiel and then we'll officially open the meetings. This meeting will be held in a hybrid fashion with the opportunity for both in-person attendance and remote participation. Please note that while an option for remote attendance and/or participation is being provided as a courtesy to the public, the meeting will not be suspended or terminated if technological problems interrupt the virtual broadcast unless otherwise required by law. Members of the public with particular interest in any specific item on this agenda should make plans for in-person rather than virtual attendance accordingly. The meeting will be held in person in the main meeting room of Deerfield Municipal Offices. In accordance with Mass General Law, Chapter 30A, anyone intending to record the meeting must identify themselves to the clerk and provide their name and address for the record. With that, I will open the Finance Committee meeting, Deerfield Finance Committee meeting at 6:02 p.m. on March 23rd, 2026.
I'll call the meeting for the Deerfield Select Board, Board of Health Sewer Commissioners open at 6:02.
I'll call the Finance Committee of the Town of Sunderland to order at 6:02.
Call the Sunderland Select Board to order, 6:02.
Call the Whately Finance Committee to order at 6:00, I can't read it, 3 maybe?
I'll call the meeting of the Whately Select Board open at 6:03.
Excellent. So the process, we will have the South County EMS Director and Board of Oversight present the budget, and then we'll give each town 10 minutes to ask questions. We'll ask the chair to sort of coordinate that with your members, and then I think we'll have time at the end of that, and then we'll just open it back up to members to continue to ask questions if you have questions beyond that. And then I'd like to quickly do introductions of the folks here, and I'll do Finance Committee, you can do Select Board. Okay. So from the Deerfield Finance Committee, if you could like stand up or wave your hand or something, Mark Brennan, Jim Cambius, John Pereski, Beth Brown, and Margaret Nardowitz. Thanks. Oh, and Julie Chalfant.
Trevor McDaniel, Chair of the South County Senior Center Board of Oversight, Deerfield Rep, and the Chair of the Select Board. Blake Gilmore is our Vice Chair and SCEMS Board of Oversight Fiscal Agent. Tim Hilchey is our Clerk and SCEMS Board of Oversight Deerfield Rep.
So I'm Val Voorhees, Chair of the Town of Sunderland Finance Committee. Here in the room, we have Allison Dean, Joseph Elias is on the Zoom, Dylan Corpita, Aaron Korpek, and Ian Raphael are also here in the meeting.
Sunderland Select Board, Nathaniel Waring, Chair, myself, Crystal Drake Tremblay is here in person, and Dan Murphy, I'm not sure if I see him on Zoom, but should be joining us via Zoom.
I'm Lynn Sibley, Chair of the Finance Committee, and we have in the room Jerry Lemon and George Reynolds on the Finance Committee. And Paul Newland? Oh, Paul Newland.
Fred Barron, Vice Chair of the Whately Select Board. Our Chair, Joyce Palmer Fortune, is right here. Our third member, Julie Wagner, is unable to attend today. I'm also the liaison with the SCEMS Board of Oversight.
Sure. Yep. Christopher Dunn, Town Administrator for the Town of Deerfield.
So I'm Holly Drake. I'm the Accountant and Budget Director for the Town of Deerfield.
Joshua Sparks. I'm the Chief of South County EMS.
I just also wanted to mention any committee members that didn't get their SCEMS budget, there's extras up here on the table if you'd like.
Okay. And one last administrative comment, be sure you talk into the microphone because that's the only way we get recorded and the only way the people online can hear us. And with that, we're ready for you to present your budget.
Great. Thank you, everybody. Thanks for putting this together. It's nice to see everybody in one room. This year, the budget increased by $90,651, primarily because of payroll, COLA, step increases, health insurance increases, and the rest of it we've been able to, for the most part, reduce. There has been a increase in indirect costs, which has been an item of discussion, but we've seen really good revenues, and we anticipate better revenues next year. So this brings the complete budget up to 1.93 million. And what we're asking for is it's just about 1.68 requested. So the big difference with this year, in addition to the increases that we all expected, was typically we have been able to subsidize the cost given to each town's assessment through the use of retained earnings. You'll all recall we sat together last autumn and we brought to each town's respective special town meetings to purchase a new ambulance. That ambulance is in service. It's on the road. It's doing ambulance calls and doing the work that we need it to do. And we couldn't get it soon enough, so we're very thankful for that. What we expected at the time, here we are today, which is because we're unable to subsidize our budget with ambulance receipts or those retained earnings as we have in years past, that brings up the assessment by roughly 25. What did we land on? It wasn't 25. We got that down even more. The percent increase, yeah. Roughly 20% increase that we're asking each town to contribute from last year. So I think what's important with this budget is to remember that this is not the first time this has happened. We've seen this since the services creation, that we've kind of gone through this every few years, where we see these peaks and valleys. And so we're at one of the peaks right now. What I'd like to do is look forward to the next town meeting with a capital stabilization fund that we can contribute to so that we're not faced with this situation again, right? I'm happy to answer any specific questions or address any concerns that I can. Or if there are specific line items that anybody wants me to go over, or I'd like to open it up for questions.
Whately, why don't you all start? Whately's up.
Yeah, I want to ask the chief.
So apologies, just make sure you use the mic.
Sorry.
Thanks.
I want to ask you, the chief or Holly, whoever, give me a better explanation of why the indirect costs to town of Deerfield went up so drastically this year after having been essentially stable for the past 6 years.
So if you ask any city and town in Massachusetts, they will probably have a different way of coming up with indirect costs. Indirect costs can be calculated in multiple different ways. The town of Deerfield has a pretty straightforward method for calculating indirect costs, and it basically takes the SCEMS budget and what percent of the entire town's budget is that. And so this year, I believe it was like 7.14% of the town's budget. And then we allocate out the costs for the departments that have to help to run SCEMS: the select board office, the collector or treasurer's office, the accounting office. And then there are some building expenses for where we all live here in this office. and some insurance expenses that then get allocated out to SCEMS. So the bigger that SCEMS budget is, the more indirect costs they are going to pay. The two big factors this year was an increase in the budget because of the capital that we added last year. There was an additional $400,000 worth of capital expenses that were added to the FY26 budget. And then the cost of health insurance, as we all know, has gone up dramatically over the last year. So that same percentage has been calculated out. I've looked back into I think it started in 1819, and capital has always been included, and that percentage has gone anywhere from about 5.5% of the town of Deerfield's budget to this is the second year that it was exactly the same, 7.14% of the town of Deerfield's budget. So that is how their indirect cost is calculated. I have reviewed it with Josh. I don't know if he has anything to add to that, but the indirect cost calculation again, just takes into account what portion of the total budget is SCEMS for the town.
Well, as I said, it went up 30% over last year. Is that account mostly because of the capital purchase by? And if so, why is a capital purchase, which was out of SCEMS retained earnings, not out of an operating budget, why is that included in the figure off of which this is based? There's no additional staff responsibility or input into that. It was SCEMS $400,000 out of retained earnings that was used to purchase an ambulance.
Right. So capital is included again, and there are additional costs. I need to set up additional accounts. Every time that a capital item is approved, it needs to have a whole new set of accounts set up on our books. It needs to be tracked. We need to make sure it doesn't get overspent. We need to pay the bills for those expenses that they are going to have. We need to mail out checks. We still need to do the same thing that we would do for a capital purchase as we would any other purchase, whether they're purchasing, equipment for the building or an ambulance. We are paying bills.
Capital purchases that go into that budget, or is it the town of Deerfield's, all of their capital expenditures that go into it?
So capital is included in our entire budget. So our capital items would be part of the big number that it gets divided into.
So
Correct.
in the past 6 years, this number has fluctuated between roughly 60 and 70,000. And now all of a sudden this year, it's gone up by 30%. What changed this year that suddenly made that number go up so drastically? Has the town of Deerfield not had large capital purchases which get rolled into this number, which should have impacted it in the past?
Right.
It just doesn't make sense to me why this year it's up 30% and it's never really changed in the past 6 years. And one $400,000 purchase by SCEMS, which is in comparison to the town of Deerfield budget, significant but not drastic.
It would be about a 25% increase in their operating budget. I believe the operating budget before the capital was 1.8 million.
But it's
brought it to about
it's not in the
2.2.
operating budget. It's a capital item.
Correct.
So why is it counted as an operating expense?
Because SCEMS is an enterprise fund, and as an enterprise fund, all of the costs are supposed to be passed back on to the SCEMS budget, and all of their costs as an enterprise fund, it is operated more like a business than it is a regular town account. It's because of its enterprise fund status that it must pay its indirect costs.
Okay, I still don't know why a one-time capital expense should be treated this way, but go ahead.
Any follow-up to that or anything else I can answer for Whately? Hi, there you are.
So you're
Up to the mic. Thank you.
Oh, hey, Becky, that's actually not on. Could you take a seat at the table there? Sorry.
So I was just wondering, we're expecting to purchase the next vehicle soon. Will that, when it comes online, I mean, it'll be about 400,000. Should we anticipate another jump in the, or has that already been accounted for in this budget?
First of all, it's really nice to see you.
Oh, good to see you. Good job.
So that money has been appropriated. As I understand it, we will not be asking for additional monies to cover that ambulance purchase.
But will it have the same impact as a capital item in the direct costs? Or were they already accounted
I
for?
believe it was already last year.
It already happened last year.
So you're talking the two ambulances, the one that's on order and the one that we just got, those have already both been appropriated. One was appropriated in
Okay.
FY26 and the other was appropriated several years ago. So those would have already been included in indirect
Right.
costs.
So we've had the impact of bringing two fire trucks online. So they both impacted our direct costs over the last 2 years.
Excuse me, in which year was the previous ambulance accounted for? Because I don't see a comparable jump in any other year.
Yeah, so that was appropriate. So there's been very little expenditure of that. The appropriation was FY24.
Okay, it's just, yeah, there's no comparable jump as there was for this year's ambulance for another ambulance.
So I'm asking this question for SCEMS. The increase this year is as a result, if I'm understanding you correctly, Holly, that the budget as presented represents 7% of the Deerfield budgets, and that's why it's 7%. It has really nothing necessarily to do with whether an ambulance was purchased or not, does it? If you're saying that, if you explain the process again, it's all expenses, whether they're capital or otherwise.
Correct.
So what you're saying is this year, this budget represents 7% of the total budgets. So it could be, paper, it could be anything. It's just the total budget represents a certain percentage of the budget, and that's how the indirect costs are being attributed to it.
Yeah, so like I'm just going to throw out a round number. So the town of Deerfield's budget is $30 million. SCEMS budget is 2 million of that. That would be approximately 7.5%. So if next year SCEMS budget was less than that, but the town's budget did not grow, then their indirect cost would go down. If the town's budget grows and SCEMS budget grow at about the same rate, then your indirect costs would stay fairly steady. But if the town's budget were to increase or decrease dramatically, and then SCEMS was to increase or decrease dramatically, then that percentage would change slightly. But again, I've gone back to since we started doing this, and it's been between 5.5% and 7.1%.
Excuse me,
for all those years.
When you say the town's budget, does that include capital and operating?
Yes.
So that includes your construction costs down the street here?
It will include the capital, each year's payment for those, correct. It doesn't all get added in 1 year because we're paying for it over 20 years. So every one of those 20 years will be added.
Whatever
Yes.
the costs allocated. So I would think that that those costs are much larger than the one-time costs for the ambulance we're talking about here. So it would seem the town's total budget would be going up a substantial amount, if only because of the capital investments you're making.
Yeah, but a lot of those are being paid for by grants as well. So they would not
You didn't say
affect that
non-grant,
necessarily.
budget, and that would include things that are paid for by grants.
Can I add a little context? I think, indirect cost is like 90,000 for the town of Deerfield to run all the stuff that it takes to run administratively South County EMS, which is about a $2 million budget. It's not exorbitant. It's not like we're padding the money here to try and make money off of other towns. It's just.
I'm not saying you do. I'm trying to figure out why it went up so much this year.
Yeah, because I think, again, as she said, it's a percentage of the budget. I mean, there's not an easy way to do it. It's not like you can, take out some costs and add some others just based on a feel. It's whatever the amount is based on a percentage of the budget. So again, some years it'll go up, some years it may go down.
So just to make sure I'm on the right page here, what you're saying is that the South County EMS budget is $1.93 million. Deerfield's budget is $30 million. And so that the percentage of the $30 million that the $2 million is equates to this. Last year, their budget was $1.84 million. How much was Deerfield's budget last year for it to be so much less that we're talking about in a 30% increase? It would have had to have been like $42 million last year in order for this percentage to work out. You're talking about the South County EMS budget going up by what, 5%? If that's the case, how is the Deerfield side so much different that we're talking about a 30% increase of the share to the South County EMS?
Yeah,
and if it is entirely driven by the ambulance, okay, why don't we see that 3 years ago and 6 years ago and 9 years ago? Why don't we see that spike every couple of years?
Yeah, it just
That's
looks like there's been a difference in the way this is calculated
correct?
in this year.
No, 2 different years. So last year we should be seeing, if it's driven by the ambulance, last year we should be seeing 80 and this year we would be seeing like 80.
I can't imagine it's all driven by the ambulance. I think a lot of it has to do with insurance and payroll and all the other stuff, right? That is kind of.
But that would be steady across all the town to operate. So like, it's not like just South County EMS, health insurance went up. The whole thing would have gone up across the.
Right. And this is just South County EMS's share of the insurance. South County EMS has its own insurance jump, $40,000 insurance jump. That's on a different line item.
So is what you're guys saying is that the indirect cost, the total indirect costs that the town of Deerfield's paying for the actual costs that you're dividing up have gone up by 30%. Is that what you're saying?
No, that's not what I'm saying at
So
all.
what is the percentage that EMS was last year of the indirect?
Last year, it was 5.54% of just shy of 32 million.
So 32 million, and you're saying that the 1.8 million of this was 5 point something percent, and this year the 1.3 million against 30 million is 30% higher.
7.1%.
Any questions? No.
Thank you, Josh.
Thank you, Becky. You dropped your hat there.
To that point, Becky, you dropped your hat on the floor. Yeah. I think to that point, in reviewing the IMA, which is something we should look at renegotiating over the next year or two, as it's stated in the IMA itself. This might be something that we could include an agreeable formula. There's no language pertaining to it. It just says that a indirect cost will be paid to the fiduciary for oversight and maintenance of its budgets, right? So I think where there's lacking language, there's certainly some room to improve that. But that by necessity is a future project. Right?
Yeah, please. Is there any questions from the Finance Committee?
Yeah, I got my, sorry, can't do my digital hand, but I got my physical hand, Val. Is it good? Is our turn, Sunderland? All right. Yeah, I mean, we're getting down to the wire with our Sunderland budget, and we've asked every other department to cut as much as they can. We asked individual departments to try to do between 5 and 20% cuts. They did, a lot of them did 5. That was kind of the best they could do. But we asked the school to cut from 18% increase to 10. Do you have any wiggle room to bring your 20% increase down a little bit?
Yeah, so I appreciate the question. I was able to reduce our operating, our supplies, our equipment, all of our operating budget. I was able to bring it down from last year. And that was also, last year was a reduction from the previous years. We've tightened our belt substantially. Where we're seeing the increase this year is not because of a giant increase in costs.
Yeah.
This is predictably because we're not able to subsidize our budget with retained earnings as we've done in past years. So this budget is exceptionally lean.
Okay.
There's little to no room for advancement. It's not where I want to be. This is bare bones what it is going to take to operate the service.
Okay. Now, in terms of revenue, I know there are charges when an ambulance goes out and picks people, and it's subsidized as well. How is your revenue stream this past year, 20 versus 24 versus 23? Has the revenue increased at all? How is your pricing?
Yeah, reliably. So I did not increase ambulance service charge rates
Yep.
for FY26. We're already on the higher end of things.
Mm-hmm.
That's not a place I want to go. What I will say is we're almost to the point of meeting what we had anticipated for the FY26 budget already. And we've still got some months to go. So that's good news. So what we've done with the FY27 budget proposal is, typically we're pretty conservative when it comes to what we feel we should budget for anticipated service revenues. In the past, this last year, for example, we put down $750,000. We know that's lowballing it. We know we're going to exceed that, but it does give us some play just in case something happens. Because of the reduction in revenues that can offset this, what I figured we would do is increase that to a more realistic number. That way we're not asking as much from the towns. It's a more realistic number, but it's certainly one that we can anticipate exceeding. So 850, I believe, is what we put. 875. That's, I would be surprised if we don't hit 900 to $1 million in service revenues next year. So it's close. It's not as conservative as we've been in the past. However, I don't believe this is the right year to give that much allowance.
Right, I appreciate that, and that makes good sense. And then the last question, just similar. Are calls up similar from the last few years?
Yeah, so we see about a 3% increase in call volume within our service area reliably. And on top of that, we have seen a very big increase in revenues because of mutual aid work, which has helped to offset some of those costs. So yes, to put it shortly.
Okay, good. Thanks so much.
No, thank you.
I have a quick follow-up question to that. Ideally, over time, what we would see is the percentage that the town is paying for any given call and the percentage that's being paid for by the insurance or whoever we're eventually charging, if it's a call that's chargeable, would remain stagnant over time. If the town's paying 30% and the money we're being brought in from those insurance calls would be 70%. I'm just throwing numbers out there, random numbers. Has that remained consistent in this budget, or is the town seeing more of an increase because, as you said, you're reluctant to increase the cost to the consumer? But sort of to the point, if what we're hearing is that it's costing 30% more to maintain this service from an administrative perspective, the ambulances are more expensive, insurance is going up. Insurance is going up. Why would we not be increasing proportionally the cost to the consumer? Because as been mentioned, this is operated like a business. Why would we not be trying to get more of the money from the insurance companies or the consumers if the cost to provide the service has gone up?
You're asking for a primer on ambulance billing, and I'm ready to give it. All right.
Josh, real quick, if I could just jump in, I'm just going to note for folks, it is 6:30. We are trying to get to the senior center budget by 7, so everyone just keep that in mind. We're trying to move quickly, so sorry about that, Josh.
Thank you.
Okay, no, thank you. I appreciate it. So We know that we are not going to be paid what we bill every single time. So if I'm just going to throw some even numbers around. So let's say the cost of an ambulance leaving the station is $800, right? We haven't even made it to the scene yet, but the cost of operating the service, the equipment, the building, the vehicles, the medications, the insurance, all of the things that combine is $800 every time we leave the door to go on a call. So let's say that we end up spending $200 in fuel and in consumables and things like that on the call. So a nice, easy $1,000 call. That's what it cost us to do that ambulance call. So depending on what insurance somebody has depends on how we're reimbursed for that call. So if somebody has Medicaid and that's all they have, I can look to get about $400, $450 for that call reimbursed. So every time we go on a call, I'm down $600. I'm losing money on that proposition. If they have Medicare, I might see $600. I think it's closer to $700 now, but I'm still losing that money. So we set a rate that is much higher than that. Let's say I bill $2,000 for the call. I know I'm only going to get $600 reimbursed off of that, which means I now have a $1,400 loss that I need to come to the select board annually and I go, hey, I have this $2 million that I need you to write off for me, right? We knew we were never going to get that money, right? However, if somebody has private health insurance, sometimes they do pay that $2,000. And that private insurance subsidizes the cost of the public payers, Medicaid and Medicare. This is healthcare billing in a nutshell, not just for ambulances, but in clinics and hospitals. And if you're a private equity group, and you're all of a sudden able to not only make money on a call, but claim a massive loss on top of it at the same time, well, it's a pretty good arrangement. So healthcare billing in our culture today is designed around private, for-profit, private equity, and that's that. If you're a small municipality and you're trying to run a service like us, it can look like a losing proposition, but it doesn't have to be. There is a limitation, however, to revenue sources for a service like ours, right? I can't simply drum up more calls. I can't decide that I need another 1,000 ambulance calls a year and go out and find them, right? Unless people want to get sick and give us a call, sure. So that's kind of how we're reimbursed. And that is why the towns have to contribute at all. Now, there's also the scenario where somebody has no health insurance. They're a private payer. They have nothing. And in those cases, they get that $2,000 bill in the mail. It's more than 2,000. It's just a nice round number. They get that bill in the mail. Most of those are going to be written off. We're never going to see it. The other things, if somebody only has Medicare or Medicaid, we don't balance bill that, right? I'm not going to go after seniors who are on Medicare and don't have other resources. I'm not going to chase them down with creditors to get my missing $1,400. You know, you already pay for Medicare, you already pay a tax assessment for the service, right? You don't need to pay us a third time. So, you know, we're not money grubbing, chasing after people, but, you know, we do try to find it where we can get it. My ultimate goal would be to dramatically reduce the assessments to each of the towns. But the only way that that's going to come is through a very dramatic healthcare reform that I don't have any hope of ever seeing. Right.
Well, thank you very much for that explanation. That helps a lot. Appreciate it. And I too am
Any,
looking forward to that healthcare reform that hopefully is coming eventually.
there any Deerfield folks who have questions that, if you can come up and just use this mic right here? No? Okay.
I had a quick question. Can you just give me the status of the ambulances as we sit? I know there's one kind of next to the building, kind of was in the snowbank for a little bit. What are we planning with that? Is that just kind of hanging till the summer, ball games and that kind of thing? Or is that planned to go out? When's the other ambulance coming? Just a quick rundown of where you're at.
Sure. So our fleet right now, we're currently operating 4 vehicles. We have the brand new ambulance 104. This is the one we took delivery on in January and just went into service this last month. It's wonderful. The one that was, we're also operating a 2017 and a 2019 that are in really rough shape. Just this week, both of them were out of service because of maintenance issues, and this is why we have such a dramatic need. So I want to give a lot of credit to some of the department members for the work they've done, especially I'll throw out Zach Battistoni's name for doing amazing work with a vehicle preventative maintenance plan. It is outstanding. So hopefully we don't run into this again, right? So those 2 ambulances are in service. The ambulance 351, the red one that you see parked outside, is not in service. It is no longer in use. We are expecting the new old ambulance purchase, the one that was appropriated in the 23 budget, to arrive in July.
Okay.
We'll see if that really happens, but it's in production right now. It's happening, so hopefully we see it. That will replace ambulance 102, the 2017, and 351, the red one that's sitting outside. So that will leave us with 3 ambulances and the Class 5 ambulance.
So you'll be left with the new one, the new one who's coming, or the new old one, and the 2019.
Correct. So we'll have 2 brand new trucks. Those will be our primary vehicles. And then we'll have the third one, which is going to be the service backup. That's essential. It's also used for details, road races, things like that. But primarily it's used when one of the others is out of service for preventative maintenance, new tires, things like that, repairs, right?
One last question. I know you've been working with other towns locally about kind of coming up with maybe a fee service. Curious where you're at on that. I don't. Yeah, you were working on that and moving forward, but
yeah. So last year, the chief of Hatfield Fire approached me, and I don't want to speak about anybody too much that they're not in the room. But it was asked if we could enter into a mutual aid and intercept agreement with Hatfield. And they don't have a substantial call volume, right? And at the time, we didn't have a substantial call volume during the hours they were likely to need us. We now are a little busier because of those calls, and that's been a really good arrangement. So what I did was I reached out to them, just looking at the cost, because I don't want to lose money on the proposal. And what Hatfield had done was they had voted down at town meeting additional staffing and coverage to fund overnights and weekends. And so to me, if you're going to vote down coverage and just say, oh, South County will do it for nothing, well, that's not very fair. We at least need to not lose money on the deal. And in fact, we should be making money on the deal. So we created a formula anticipating that we would be reimbursed by insurance for the calls that we do there. So how can we offset that? So what we came up with was a formula that's roughly it's a $350 per call fee that I will begin charging to the town of Hatfield on July 1st.
Okay.
The idea with July 1st was that it gives them enough time that they can budget for it, or they can come up with an alternative and say, thank you, see you later. And I'm fine with that too.
Yep.
As I understand it, that is up for discussion with their select board, and I don't know where it stands, but to me, it's just, it's not really a dialogue. It's not a question. It's going to be a bill in the mail.
Right. That's
So,
fair.
yeah.
And not taking advantage, but also just covering costs.
Well, I feel like we're being taken advantage of, and
Right.
we want to avoid that.
Yeah.
So,
Okay.
yeah.
Thank you.
And not to open a whole beehive, but is there any appetite on either side to expand the South County towns to include Hatfield in general, if that's the situation that they're in? Or would that be, not beneficial to our side of things?
Well, I'm not closed to the idea. However, when you take on a project like a new town, if you were that town, you'd want to make sure that you're getting what you wanted out of it. And, it takes there's a real need to look at resources and deployment and staffing and make sure that we could actually deliver on that. So I think the current arrangement is a great deal, even with the $350 apron fee. It is a great deal for Hatfield. It's certainly welcomed revenue to help subsidize our own service. And primarily, we haven't really lost a ton of calls to this. So it's been a really good arrangement for us. So never say never, but it's a big, big ask. Any other questions I can answer about our budget?
That's what I was just gonna say. It's awfully quiet. Is any further questions? No. Are you all interested in voting the budget tonight? Or are you gonna go back to your finance committee meetings next week or something and vote this budget?
I don't want to speak for the whole board, and Crystal, you're welcome to reply, but I believe our plan is to bring this back to our meeting tomorrow. We have another meeting scheduled for tomorrow to discuss it
Okay.
amongst ourselves.
Whately is the same way. We'll bring it back to our next finance committee meeting.
Okay, perfect. Is there any public comment related to South County EMS?
It's
One hand on Donna from Sunderland online.
Hi there. Sorry. So, I guess my question has to do with the last conversation that we had, and I wonder, I know earlier you said you were just throwing out a number if it takes $800 for you to kind of roll out of the station to meet a call, and you're offering Hatfield $350. My question is, why would it not be about half or three-quarters of what it would actually cost? Because I know it's still a deal for them no matter what. And why would you not want to, I guess, make it a little more equitable? That's all I was thinking, is it didn't sound equitable, but I just wanted to put that out there.
No, I appreciate the question. Thank you. So it is equitable if you look at it that it's roughly what our three service towns are paying percentage wise.
Okay.
So
Okay.
it doesn't
Great.
charge them more necessarily, but we also know that we're going to be reimbursed for the call through insurance. And so even if we get the 600 or 700 from Medicare and we get the 350 from Hatfield, great. We've broken even on this call and it's going to be fine. Most of the time in Hatfield, our insurance reimbursement mix leans on the private insurance side of things. So we tend to do pretty well from it.
That's wonderful. Thank you so much.
Thank you. I appreciate it.
Is there? Oh, yeah, go ahead, Margaret. Come on up.
I know Josh will know the answer to this. How much does Northampton charge for their intercepts? If they were to go to Hatfield, how much do they charge?
My understanding is that they, prior to us, a couple of years ago, Northampton offered them, I believe it was $500, which Hatfield declined, and Northampton stopped responding to Hatfield. I don't want to see anybody lose access to emergency services, least of all healthcare, which is another reason for giving this time allowance and saying you have several months before I institute this charge to decide what to do. But we are going to be in a similar scenario where if they decide that they're not going to do it, then we too will stop responding to Hatfield. I sure hope it doesn't come to that, because it is really beneficial for everybody. And, you know, once again, I think the biggest thing is, you know, forgive me, I think ultimately I'm maybe altruistic about this, but we are there to perform a healthcare service. And I don't want somebody to not get the help they need when there's a perfectly good solution sitting there, right?
Josh, excuse me.
Also, I think there's reciprocity with that. Of course, if Hatfield comes and responds within our service area, I will more than gladly pay them in kind.
How many calls are we talking about that Hatfield would be paying? You said it was only certain hours and things like that. An estimate, just ballpark.
Yeah, for sure. So I only have figures through the end of December. I don't have the complete data yet. So for the first half of this fiscal year, we went to Hatfield roughly 90 times. So we're looking at a couple of hundred calls per year, which is not hugely busy, but it's also not inconsequential, right?
Can you remind us what your call volume is overall for a year?
Yeah, we're sitting around 1,800 calls per year. So as a percentage of our entire call volume, it is substantial.
Anybody else? Nope. Okay, we are going to take a 10-minute break. We will shift South County EMS for South County Senior Center, but we will, honest to goodness, 10 minutes, not 20 minutes. So we'll start back up in 10 minutes at 7 o'clock.
Thank you, everybody, for your time.
Thank you.
Thank you for all your work.
It's 7 o'clock. Can you, thank you.
Yeah, no.
What's that? What's going on? It just started again. Yeah, thank you.
That's not having fun.
Yeah, there we go. Okay, and I can just remind you to speak into the microphone really well so that folks can hear.
Is someone admitting people into the room, though?
Oh. Yep.
Okay, can you hear me okay? All right.
We had nods in the back. Yep.
What was that? Okay.
We had nods in the
Great.
back.
So we're going to do an overview of a presentation about what the Senior Center offers and where we are with finances. My name is Jennifer Ferrara. I'm the director of the South County Senior Center. I'm joined in the audience by my outreach coordinator, Chris Goudreau. Tom Patria, our program coordinator, is unfortunately not here this evening. We report to the Board of Oversight, which is currently chaired by Joyce Palmer Fortune of the Whately Select Board. Our Deerfield member of the Board of Oversight is Select Board member Trevor McDaniel, and for Sunderland, our Select Board member Dan Murphy. A brief history of the South County Senior Center. So the South County Senior Center is currently made up of 3 towns, Deerfield, Sunderland, and Whately. It's been in existence since 1978, but we have found records that refer to the Frontier Senior Center in 1973. We have recognized the need for a larger and better space for a long period of time. Many earlier efforts were conducted were needs assessments, analyzation on the building conditions, and the building use surveys conducted between 2010 and 2020. Financing renovations and maintenance of existing buildings owned by one town halted these efforts like a brick wall. We were always told this was too expensive. A new needs assessment was conducted in the fall of 2021 and presented to the communities in the spring of 2022. A new feasibility study was conducted by EDM Studio with the support of Sunderland and Whately at the behest of Deerfield. We presented those findings in the spring of 2025. New, more affordable options have been identified since then and investigated by the South County Board of Oversight, myself, and various community members. This particular parcel avoids the purchase of a new building, which would put an undue burden on the town if any maintenance costs occurred. And it would also avoid ownership by one town. Let us all try to avoid the brick wall around this time together. So for those of you who may not have ever been to the South County Senior Center, because there are some unfamiliar faces in the audience today, what do? We provide our seniors with community. Our outreach coordinator connects people to services. Chris and the Senior Center works with the Food Bank of Western Mass and the Franklin Area Survival Center to provide food assistance support. We are also a certified SNAP processing site where we work with the Department of Transitional Assistance through the partnership with UMass Chan Medical School out of Worcester. We also are certified through Community Action Pioneer Valley to help folks with the fuel assistance applications. You may hear it as LIHEAP or HEAP. Also, with various grants, we were able to purchase a new 14-passenger vehicle with 2 wheelchair accessible spaces and also additional funding through capital. We provide programming support or transportation to provide support for programs and to various medical appointments throughout the community, bridging the gap between the FRTA and the PVTA. We are a host site for the town nurses to congregate and to provide services to the older adults in our community. An issue with all of the medical services is there's no private space to host these events unless we close our entire center. Although the town nurses are accessible, there is no private room for there to access services with the seniors. We also host a foot clinic once a month and offer blood pressure checks. Currently, we navigate partnerships with over 20 community partners. Some of those include Valley Neighbors, LifePath, and the various triad units. Programming. We connect people to each other. Our programs provide many opportunities for social connection. We offer various art classes, including watercolors, drawing, and knitting. We have movement classes, which were one of the top priority needs listed in the needs assessment from 21 to 22 for all abilities, not just those who are able to stand and move, but for people who need access to chairs to provide their movement. We offer games on a regular basis. We host visits with our local, state, and federal representatives. We offer field trips to local museums and historical centers to enrich cultural learning. We connect people to reliable and helpful information. We provide lifelong learning. As some of you may be aware, if someone is to remain isolated on a long-term basis, their brain function deteriorates and increases the risk of dementia. Our programming is done with brain boosting activities. We bring in subject matter experts to do presentations about nutrition, how to stay healthy. We offer resources on scam prevention, which is really essential in this time. Over the past couple of years, we've been able to connect people with technology. I applied for and received a $100,000 grant to have the lottery and place 170 iPads into the hands of seniors in all 3 towns. I also applied for and received a grant, approximately $120,000 for technology training and online accessible programming, so those who could not attend in person, such as homebound seniors, could access our programming virtually. In the last 4 years, since 2022, when I came on board, I've brought in over $492,000 in competitive grants. Connection and community. So while some folks may think that the senior center is just bingo and coffee, it's so much more. As I mentioned before, the seniors are at an increased risk for isolation, and that isolation is associated with mental health decline, physical health decline, reduced quality of life, increased suicide risks, and increased mortality rates. By 2035, 37% of the regional population in South County will be 60 and older. The senior center demand will continue to increase as residents want to age in place. Now we're going to look at the data.
Thank you. And I'm Joyce. So I've got a bit of data about the South County Senior Center that I think people have asked for in the past, and I wanted to show that. This is a chart and a graph showing our active membership over time. This particular graph shows the membership of all 3 towns. So it would be this green line across here that's being graphed. I actually have graphs for the separate towns as well. But you can see going from 2018 to 118 people from our 3 towns, all the way up to almost 600. That's a factor of 5 increase in the number of seniors who are members, who have participated and interacted with the South County Senior Center at least once annually. But I will show you for the individual towns. Here's Sunderland. Gosh, looks a heck of a lot like that other one. Here's Whately. Really just looks the same. And here's Deerfield, and these look very, very much the same. There's one place I want to point out here. Somewhere around 2023, we moved from renting the parish hall at the church in Deerfield to the small space we're in Sunderland. And I just want to point out that it was not a barrier for Deerfield residents. It was certainly not a barrier for Whately residents to get over to Sunderland. It proved to be a popular location. We got over 100 new Deerfield residents as members in the time that we have been over in Sunderland. So I just wanted to point that out here. Participation over time. Now, if just by having a member who comes once a year, that doesn't seem like very much. So what I wanted to impress with you here, on the previous slide, in 2018, Deerfield had something like 92 or 93 members, but in that same year, they interacted with the senior center over 4,700 times. So this is telling you that people who are engaged are not really just coming once a year. On average, they're coming much more. And this curve, of course, follows the same curve we had on the previous page, although, you know, we can all see something happen around 2020, 2021 here. Okay. So it might be interesting to know, like, how many, like, what's the average per person usage of the senior center? I did this, I averaged over a period of years. In a way, I wanted to make this one, this 2018 to 2021 was, like, we call it BJ, it's before Gen. And then there's 2022 to 2025 is AJ, after Gen. And just the amount of participation per person, that's what the PP stands for, went up substantially over that period of time. Now, granted, a little bit of pandemic probably kept this down. For 2025, this is where we are. We are having people interacting with the senior center on an average of about 40 per person who's a member of the senior center. We do allow people from other towns in, and they come at a lower rate. Okay? So that's a little bit of information about the usage and the demand we have for the senior center. There's a few things that I think help explain these numbers. For one, we've been giving a steady increase in the services and programs at the South County Senior Center. Specifically, since 2018 to 2025, we've increased the staff from 1.5 full-time equivalent to 3 full-time equivalent. And I have to say, we have the most awesome staff we have ever had in the history of the senior center. Back in 2018, we were open about 12 hours per week. We're now open 32 hours per week. The previously unmet needs in our community are really beginning to be addressed. And I think that our staff deserves a lot of credit for that. But at this point, we need more space. That's really the bottom line. And I'll give you a little bit more information here. Right now, we've got that small space, but that's not the only space where we operate. And I excuse the small font here, but there's just so many places that we're operating out of that I had to use a tiny font to get them all on one page. There's our space at 22 Amherst Road, a room that is smaller than this one, and it's one where we can hold small events. We can have a small food pantry there. We have grab-and-go lunches, some things that don't involve. Use the First Congregational Church in Sunderland. That is a great little space. We pay a very nominal fee to use there. It's just a bigger room. Yeah.
Is the microphone changed? Can you still hear it on the computer?
Mm-hmm. Okay, thanks. So we tend to go over there for food distribution. We have monthly food distribution events there. We use the Whately Town Hall, and thank goodness it's there, big enough for a 20-person exercise class, no bigger than that. So we sometimes turn people away in our movement classes. We also have Jim McGovern there to meet the seniors. We have a partnership with a yoga studio down the street in Sunderland. So some of our classes can be held there. They do chair yoga and balance. There's the Polish American Club in South Deerfield. God bless them. They let us use their big room for congregate meals. We do that about 4 times a year. And most of the time we are turning people away because we fit like 100 people in there, but it's like 100 people. And when you are in there with a walker, then you are going to find your seat and you're going to stay there because you are not walking around in that room. That's a wonderful resource that we're using. It's mainly for meals and some social events. And then we also use the Deerfield Town Hall, I think specifically for brown bag food distribution. People can pick up a bag of food once a month for that one. Yeah. So we are at this point working at a lot of different locations, which is taking its toll. Oh, I forgot, hybrid programming by Zoom, especially facilitated by that grant, so that people can Zoom in to events that are maybe over at 22 Amherst Road. Okay. But this dispersed programming is what I call it. Dispersed programming, it's confusing to seniors, and it's an inefficient use of staff time. For the staff time portion, what I would say is we looked at just Tom Patria's hours, and about $7,000 worth of his hours are going towards packing up the car, getting over to the town hall early enough to turn on the heat, to turn up, get the chairs out of the way or put the chairs in the way, and then all of those hours add up. It's an inefficient use of our staff, and our staff is really what makes this place run. It also presents a barrier to what I would say the newest or neediest of our seniors. Imagine the senior saying, "Hey, it's our senior center, let's go, gets on a bus, gets a ride from somebody, and you find out, oh, 22 Amherst Road is closed because everybody's over to Whately Town Hall, or they're over to Sunderland Church, or it's been confusing. We've got lots of complaints from our seniors about missing things because they wasn't clear where they were supposed to go on a particular event. So if we have one suitably large central location, we could actually provide more services without having to increase our staff, because our staff would be able to use their time that much more efficiently. We'd be able to have more events, small and large, in a space that we can all be in one place. So a one-stop senior center, I'd say, is essential to support the current success and to serve the projected growth of older adults in our community. And I've got more numbers on that in some pages to come. Okay. So we investigated many locations. I'm going to talk about 3 of them tonight. Well, 4 of them. I've got the new build within the 3 towns is sort of a fictitious one. We know how much it would cost, but we don't even have a partial blame to put that on. So that's there for comparison purposes. We actually considered a lot of other places. My inbox is full of people who think we should go to the Volvo dealer up on 5 and 10. And for various reasons, that one is not included here because it's not going to be feasible. But let me go and tell you a little bit about what we learned. First off, with the finances up front, and then a little bit more about how we got each of those numbers. So we looked at the cost per square foot of these locations. If we had a new build, our new build would be greater than $60 per square foot. If we were to renovate this building, it would cost us at least $38 per square foot. If we were to either stay at the 22 Amherst Road or move into 112 Amherst Road, it's going to be about $14 per square foot. And $14 per square foot for build to suit is really good. That is not a high price. That's a really good price. The other thing we looked at is how much would it add to somebody's tax bill. So if we were to go with a brand new build, like the consultant said, that would meet all of our needs, we'd be adding annually about $240 to the tax bill for a typical single family home in any of the 3 towns. If we were to do the same here at 8 Conway Street, substantially lower cost to renovate than building new, but still something like $100 per year more on people's tax bills. And that's, we're basing that on a single family home. The 112 Amherst Road would add $50 annually to those tax bills. Okay, which is substantially less. I don't think we will ever be able to do better than that number. And one of the reasons I think that this is the thing we really ought to go for is that brick wall that Jen mentioned before, that brick wall of renovating a publicly owned building is expensive because of procurement law. The cost of the small renovations needed at 112 Amherst Road are not subject to that same law. So they can have the work done internally with the people who work with them. They can call them contractors. They can do it at a much better price. Okay, that's the main thing here. It's also the case that this building would not be owned by any of the towns. I know in the past people have had trouble like if I'm in a Whately, maybe I don't want to have my tax money going to do renovations in a building that Whately doesn't own. Okay, and I can understand that, and I think I've heard similar sentiment from folks in Sunderland that I don't want to renovate a building that's not in my town. But here, this is owned by a private entity. They're giving us a really good deal, and that's why this is $50, because we've got a very good citizen running that building and wanting to make it available to this community. Okay, a little bit more on how things were calculated. This has got probably too small a font. So those numbers I gave you are down here at the bottom, the square footage and amount of tax increase. If we were to get what the consultants say we need, we would have to get about 18,000 square feet. We're not gonna get that. That's, I mean, we know that. This is all red over here, after all. 8 Conway and 112 Amherst Road are similar sizes. There's some dispute over what the square footage is of each place, but I'd say they're not that different in size, 10,000 or 12,000 square feet. Is so much better than the 2,000 square feet we have right now. That the size is probably not the issue here. The issue is the cost and the timing considerations. So this building may not be fully available for quite some time. It nominally may be ready in 2027. That's if nothing goes wrong in the construction and moving people out. I've already heard that there might be some departments that aren't moving out quite soon. So there's a lot of iffiness on when this might be ready. And then there's the extra cost of renovations that have to be done under prevailing wage. And then you have to also use a lot of procedure and putting everything out to bid. And all of the things that cost time limits. So that option is going to be much more time consuming and much more consuming of our tax dollars than renting from a private entity in a building that exists that is in awesome shape. How many people in the audience have gone over to take a walk through and see the place? Yeah, we've got a lot of people who've seen it there. Okay, so I think I can easily say that location is like really just about ready to move in. They've got what they say is about 3 months worth of taking out a few walls, moving a few doors, replacing carpet with tile. It's not extensive renovations. The biggest thing is that they have to add 2 bathrooms in order to get our capacity of the building up. So that's going to be the thing that will take the longest, is putting in the 2 bathrooms. I think the reason why the cost here is so much lower, in addition to the fact that it's not under prevailing wage, is that they have a different way of looking at it. And they said, well, if we put the bathrooms where the consultant said, yes, it would cost a lot of money, but if we put them here, it won't cost so much money. They really know their building. They really know that building inside out, and they've been taking care of it. It was built in, now I'm forgetting it, 72. And I have been in the building that was built in 72 that didn't have a twinge of mold or mildew in the basement. Not a single indicator of any mildew of any kind there. The HVAC was a fairly recent purchase. It's in really good shape. It's not a building that needs extensive renovation. Okay. But it is still a substantial amount. We're basically asking you to double our budget, a little bit more than double our budget. Okay. So let me go next slide. So if we were to continue at 22 Amherst Road, we're asking for an additional $46,000 over last year's budget just to keep us over this level, to keep our 3 awesome staff members in place, and to just those. That's what the cost of doing business looks like. If we were to move to 112 Amherst Road, we'll be asking for about $239,000 over and above what we asked for last year. Okay, so that's a little bit more than doubling our budget. Okay, so I mean, the same thing that, so that's good. Now this is a screenshot of a spreadsheet that I got from Julie, thank you very much, to help us figure out how much would these costs increase your taxes. So we used your calculator, and it's all in fine print because this is a great calculator, but let me take the important part down there and put it up there. If you live in Deerfield and we were to remain at 22 Amherst Road, if your house is valued at $450,000, you will pay an extra $11. In Sunderland, an extra $9. In Whately, an extra $10. That's keeping us at level service. And this is per year. Oh, sorry, per year. Okay.
Is that the total budget, or that's the increase?
That's the that is the increase.
Okay.
That is the increase over last year. Okay. If we were to move to 112 Amherst Road, we would have, for a $450,000 home, an increase of $54 in Deerfield, $46 in Sunderland, $51 in Whately. Okay. There are other pros and cons that you should probably think about. Different locations have other aspects that are really good. For example, the 112 Amherst Road has some wonderful outdoor space. So we could actually do gardening, we could start growing some of our food that we put in our food pantry. Over here, the ideal place might have some outdoor growing space, but at our current location, no. And at 8 Conway Street, there's no place we can put in some gardens. There's major renovations needed in one case. The building is in excellent condition over at 112 Amherst Road. For maintenance, it's largely be taken care of by the owner, who knows the building and knows how to do it, and can do it in a competent and a cost-effective way. So we don't really know what the operating costs would be here. So that's one place where I put a little caution. The accessibility, there's a 3-story building. 2 of the floors are accessible directly, and the upper floor is accessible via stairs and an elevator. The elevator is not current ADA compliant, but it is large enough for a wheelchair and an attendant, and it meets the exemption for existing buildings on the elevator. We have found that most of the time when we're over there, we've been over there, how many times have we done that roughly? 7 times. And each time, 1, maybe 2 people needing to use the elevator to see the second floor. So in view of that, what we'd like to do is use the upper floors for things that are primarily for able-bodied folks who can use the stairs, and put the programming that is really for everyone, regardless of ability, on the first floor and the second floor, the ones that are accessible directly from the ground. Okay. For parking, it's not sufficient where we are. It's probably not sufficient here. If any of you tried to park nearby and come to this meeting, you'll know what I mean. Here, the parking is better, but not perfect. It's got about 45 spaces, and he thinks he can add a 6 or 7 by changing the way it's striped. The folks who did the work for us said we should aim for 110 spaces. So this place isn't perfect, but it's so much better than what we have now that I think it's really worth us seriously finding a way to fund this within our communities. If we do this renovation, which will have a shower, we can actually use that place as an emergency shelter as well. As far as I know, you'd have to put in a shower here as well. They have to be part of renovations to make that work here. One of the things Jen alluded to earlier, there are no closed-door offices over at 22 Amherst Road. So I'm going to have a conversation with someone about their needs for SNAP or whatever other kind of support they have. They need to do it when the center is not open to other people, which puts a burden on everyone. However, this was an office. This was an office building, so the office, there's multiple offices. You can close the door. You can have a private meeting with someone who is able to take advantage of services. So these are some of the other considerations we have when we're thinking about the locations. So my last bit of data is this. Our current senior center budget is a very small part of our town's annual budgets. And this is based on fiscal year 26. We were 0.46% of Sunderland's budget. We were 0.76% of Whately's budget. We were 0.54% of Deerfield's budget. We are a very small part of our municipal government budgets. Let's look at the number of people though. And someone asked me to put this in. What we have here is for, let's look at Deerfield. according to the 2000 census, we had 915 people in the ages 5 to 19, which is roughly school-age children, for whom we spend about 70% of our budget, 60 to 70% of our budget on our schools, which we should do. I am not advocating cut the schools in any way at all. We should invest in our youth. And at that time, there was approximately the same number of people over age 60 living in Deerfield. Go to 2020, we've got somewhat fewer young people, but we have doubled approximately the number of seniors who live in this town. That's probably also one of the reasons why the usage is going up. Okay. And Sunderland, the story is not very different in Sunderland. Maybe back in 2000, they had more children than they had older adults. But now they've got many more, about a factor to more older adults than children in school. And Whately, same thing. We are all the same story. Now, these are raw numbers, so this gives you an idea that right now in our towns, 1639 plus 844 plus 544, that's the number of seniors we have in our town. That's over 3,000. 3,000 senior citizens among the 3 towns. Okay. So, because I'm a science teacher, I could do it in percentages too, and maybe you'd like to see it in percentages, but the percentages tell the same story. We're sitting there in like 15 to 20% back in 2000 of young children, and roughly the same number in percentage of older adults. And we're now in the place where the older adults are about percentage-wise as well, double the number of young children. Okay, so I just wanted to give you those numbers for some perspective, because we are a small part of a large budget. Okay, so I know towns are in trouble with the override, but we're asking you to increase our budget from 212,485 to 451,845. The difference is 238,980. Okay, that is apportioned between the towns according to the population of seniors. So the fraction of Deerfield seniors happens to be 54% of all of those 3,000 plus seniors live in Deerfield. 28% live in Sunderland. 18% live in Whately. So those are our numbers. I'll let Trevor.
You were saying it was muted online or muffled, and I was trying to figure out where the.
Yeah, I think I messed it up.
Yeah, that's why I was asking about.
Hey, Dan Murphy, can you hear
There
it?
you go. Now
If you nod or thumbs up?
it's going now. Sure. Yeah, that switched it back to what it was, but it wasn't. I don't know. They said it was muffled, so.
It's
Okay.
it's definitely muffled.
Dan, can you hear us?
Yes, I can hear, but it's a little bit. It's definitely muffled.
I
It
can't hear Dan, but he's
Oh.
he's definitely talking to us.
Oh, I unplugged it.
You can unplug it. Oh.
No idea how happy it makes me that not just something.
Oh, no. It's okay. Can you hear us now? Thumbs up or thumbs down? Nothing there.
Speak a little louder.
Oh, okay. I will try to speak a little louder. Can you hear me? Dan, can you hear me?
yes, much better. You came back.
Great. Thank you. Well, it was mostly on the slides, so I'm thinking we don't need to go back. Okay. So,
Yep.
even in towns where you may need to go to an override, my pitch to you is please go for this override. Ask the people in your towns. Let the people vote on this. Let's not squash this before people get a chance to put in their 2 cents. And sometimes as a board chair or as a select board member, or I imagine also as a finance committee member, you don't want to go to your people and say, oh, we need to have an override. But you know what? Sometimes we need to. In about 20 years ago in Whately, we needed one. We were at the point of cutting our school librarian, about cutting our library hours substantially. We were losing things that people really, really wanted because it's only part of discretionary discretionary spending that we could really do anything with. And we explained it to people. This is what you're getting for your money. And they voted for it. Okay. And I hope that the boards here will take that into consideration. Let the people of your town decide whether they want a bigger centralized senior center. And don't take that choice away from them before they even have a chance to say anything about it. Okay. So this is really my last slide. I think this is a matter of equity. You saw the population numbers. We are an older community. I think it's a matter of quality of life. Jen spoke to that. That isolation can kill and it can ruin your quality of life. This is about helping seniors live and thrive in their community. And this is about committing to the health and well-being of our seniors. And I would say none of us can do this alone. This is not something Whately can do on their own. This is not something Sunderland can do on their own. And it's not even something Deerfield can do on their own. This is something we need each other. We need to keep doing this together. I hope we can find a way to move forward on this together as 3 towns. Thank you.
Let's go ahead and move on. We'll start, Whately started last time. Sunderland, why don't you start with questions?
I have a lot of them. So I just want to start off by saying I am fully in support of
I'm just going to interrupt you and remind you to use the mic. Thank you.
I'm fully in support of this project. I think this is a long time coming and very much needed, not just based on the population numbers, but on the fact that for the last number of years, we have been underperforming in terms of our services we offer our seniors. So I want to start with that. My concern is not so much about whether we should go ahead with it or not. It's about if we do, how are we setting it up so that we can afford to do so? My concern is that as it stands currently, my understanding is that the towns are going to vote on this project independent of override votes. My concern would be if the override in my town, Sunderland, fails, the vote for this passes, we're looking at absorbing a substantial chunk of money that we just found out that we don't have, and we're already looking at giant cuts to our town services. So my question is not like why we shouldn't do this. The question is how can we set this up in a way where the vote for the project also includes a built-in override for that, so that the people who are voting on it are not just voting on, yes, I want to go ahead with this, but yes, I'm willing to pay $37 more a month or a year. Because if we don't pass that, we're in a situation where, I mean, it's drastic in Sunderland. We're talking about losing huge swaths of our school. We're talking about losing days at our library, a whole bunch of things like that. It's hard to swallow an increase of this size without the increased funding. So I don't, as of now, know entirely what the plan is for what's going to be on town meeting rosters, what's going to be on the vote. I just want to make sure whatever we decide in that respect sets us up for a way where it's either all or nothing. Either the towns agree for it and they fund it, or neither.
Yeah, my understanding of the process would be all 3 towns have to agree to it, or I don't have the budget. I can't move in with just 2 out of 3 towns' support. Further on the process, and maybe there are people in this room who have more to say about it, more municipal experience than me. But I think your annual town meeting would have to approve the fact that you would go to an override. Basically, there has to be an article on your town meeting warrant, and say you're going to fund I don't know, in an ideal world, you're going to fund us at our full ask for the 22 Amherst Road. That can be in your regular budget. And then that the override be a separate article that people can vote up or down at town meeting. Voting it up or down at town meeting doesn't mean you get the money, right? It means you can go to the ballot now to have people vote on an override. And it would be a Proposition 2.5 override. It would permanently raise your levy limit. So you have that levy limit for the next year. So I think, I mean, the situation in Whately was a while back. Lynn is very familiar with it. We were just smack up against our levy limit, and it hadn't been changed in years and years and years and years. And every so often, you have to raise your levy limit because the cost of doing government rises faster than 2.5% per year, as you're well aware of, and I think Deerfield is hitting close there. Then it's a matter of, do we want to have a good local government or not? And I can't answer that for you, but I can say that this is not that much. $120,000 is not a big override amount. For Sunderland, it's more like 63 or 64,000. That's not a lot. No, that's not the override amount. That's the total budget. Yeah. So the override part is about 60,000. I think we should let people decide if they want to raise their own taxes for that. So the process, you'll probably get better advice from your town administrator, or maybe even our finance chair might be able to tell you as much. But it's a process. You have to get the permission to do the override vote from your town meeting, though. That's what I remember. But have I got that basically right, or do you want to correct me on that?
If I can just clarify quickly,
Yeah.
One of my concerns is that because the vote, and again, correct me if I'm wrong, the vote for moving ahead with 122 is a vote with all the people in all the towns.
Mm-hmm.
It's possible that Sunderland residents would vote down the move, and those same people vote down the override. But the rest of the towns vote yay, the project moves forward, and Sunderland's
No, it
still
wouldn't
on-
move forward.
No, it doesn't move forward
It's
if the other.
So it's not.
It's all or nothing. It's not.
Then never mind.
It's all or nothing.
That concern is okay. That makes a lot of sense. That would be.
It is all or nothing.
Okay.
But I want you to give us all.
No.
Okay. No doggy downers here. Give it to us. Give it all to us.
I think
Because we're a small part of a large budget, and that means we're a small part of a larger problem in some ways.
I think the other item was, I think one of your concerns were, so you vote the senior center budget at the moving in rate, and then the thing fails, and now you're forced kind of to do that, right? And I think somehow we have to make it, that warrant article has to have language contingent on passing of otherwise your budget would then revert back to the lower amount. And I'm not a parliamentarian on that either, but I think we'd have to structure it such in a way that if it doesn't pass an election or a ballot question, then it would revert back to your normal.
Those are discussions we had on that side as well.
Yeah.
And just to clarify, the wording of the town meeting article and of the election piece, both of those will include the funding as what they're voting on. So when they're voting on this is I'm voting both to increase my taxes and I'm voting to go ahead with the new building. Is that correct?
I'm increasing my taxes for the purpose of funding.
Beautiful.
And you have to specify what it's for. Is that not correct, Lynn?
Yes. When we passed ours, what we did is we went to town meeting with a recommended budget. We had 3 columns, and one column was how much was the contingency of an override, so that when we went to vote on that, we actually had a budget, and we didn't have to go back to town meeting if the override didn't fail. I mean, if the override failed, but then the amount was included in the override vote, and luckily it passed. So that's how we did it.
Wonderful.
And just to let you know, in the documents that you have the no-go budget in addition to the go budget. I do want to share that there was $100 difference. I made a typo on the repairs. It went from $100 to $200. So I'm going to correct it to be exactly what Joyce had on that. So that line item is going to change and drop it to equal the exact dollar amount that was on the presentation. But I just wanted to share.
And just before I pass the floor to someone else, I see even in the not moving ahead budget, we're seeing about a 32% increase. A couple of those drivers of that, it looks like there's some personnel drivers. I'm assuming that that's contractual obligations.
So yes, the grants that we had been funding our outreach coordinator with for the majority of the part, went away. We do have a partnership with the PVTA, which we are doing funding, but that is not a set amount every week. So I put the full dollar amount in there. And if you look at the Fund 291 budget, which is the formula fund that we receive from the state for $16 per older adult, it's the single side that looks a little hard to read like this one here. This isn't one that gets voted on. It's I've pretty much been left up to the discretion of how to use it, and the majority of it goes towards staff salary for our program coordinator and our outreach coordinator. And then office supplies, our cable, internet, our phone, our MCOA and the motion picture license, and the MCOA conference that I usually attend annually. We cut out quite a few things that we normally have had in here because we want to make sure that the most important things get funded.
And another item I'm seeing is the snow removal on your non-moving ahead budget is going from 1,200 to 3,000. Is that?
Yeah, we went through our entire snow budget in like 1 month. It's way over what we budgeted for fiscal 26. So I'm looking for ways to cut corners in addition because we had a lot more snow and ice this season than we have in the past.
And the 122 location, sorry.
The 112.
Sorry, 112 location. That snow removal is included with that?
Yes, so that includes all landscaping and all snow removal. The only incidental or the only things that we would have to do as staff is incidental shoveling like we do now. We shovel the stairs, we put out rock salt, so if something happens in between the time that the plow comes through to take care of that, we just, we make sure people are safe to come in and out.
Wonderful. And my last question is that my understanding is that the kitchen at this new location is not currently what you would love it to be long-term, and that there is a plan in the next couple of years to revisit doing some work on that kitchen to bring that up to the needs you have for the events you do run and whatever. Do you have an idea of what that would look like? Next year's budget's not going to be like this one.
Right.
So just kind of getting a feel for that.
I'd say two things. That yes, we do have some estimates of what it would cost. But we are also aware that we are in kind of the valley of 5+ colleges and many private institutions who on a regular basis upgrade their kitchen equipment. So if we have a place to actually put things, then we can take advantage of donations much more readily and bring down the cost of that commercial kitchen. If we had to buy everything new, what was the estimate you had?
For fiscal 25-26, I had put in for a grant application using price points in that dollar amount from Gillette and Holyoke, and the ballpark for everything that we needed, including the grease traps, was around $25,000 to $27,000 for brand new equipment. Given, tariffs, et cetera, it obviously could fluctuate. But I do want to share that we are working with a new nonprofit, Building South County Communities, who is also helping to fundraise to potentially offset some of these additional costs that could come forward.
Great, thank you very much.
Just want to point out Joe from Sunderland's got his hand up online.
Great, thank you very much. So, correct me if I'm wrong, but I understand like Mass in Motions through Life Paths. We have a Mass in Motions committee council in Sunderland. Doesn't that Life Paths channel some money to our town? Is that managed by Jennifer? And does Deerfield and Whately, do they also have Life Paths committee?
So Joe, thank you for that. The funds that we have, $12,690, is monies from all three towns.
Oh.
So while we meet in Sunderland, there are members of the work group that you're part of that are come from all three towns. So that funding there is a non-competitive grant that we take in every year, which we were told it was supposed to go 10 years total, and I think we're at year 3. So we purchased our freezer with that, but I think unless you're the work group that meets were to vote to use all of those funds for that purpose, and FERCog would have to determine if that's appropriate or not.
Okay, so it's 12,000 total, all three towns, not just Sunderland. Okay, thank you.
Yeah, $12,690.
Oh, okay, thanks, Jen.
You're welcome.
Go for it.
One quick question, or ask for a clarification. In the past years, Whately and Sunderland's allocation through the intermunicipal agreement has been the same, and now they're different. Can you just go into the background of the discussions that went into changing that allocation?
I think those discussions originated at a Whately Finance Committee meeting in a year or two ago. And people were, looking at the numbers and saying, hey, we're the smallest of the three towns. Why are we paying the same as Sunderland? And we said, well, let's look into it. So we looked into several different ways that you might think about apportioning the budget. We looked at using the census data, which gets updated every 10 years. And we looked at our usage data, which we had going back to 2018. And when we looked at them, the fractions actually were pretty close to each other. If you look over time, Whately's participation is almost up to 18%. It had historically been lower. Deerfield's had been much higher, but as a percentage, as Sunderland and Whately residents started using it more, their percentage has actually come down over time. And Sunderland used to be 25%, now it's 28%. Not a big change. What we looked at was that numbers maybe year to year might fluctuate a lot on usage, and that is it puts demands on us, like finding data and then getting it to boards. So every year we didn't want to change the fraction every year, but it was so close to our fractional distribution of seniors among the towns that it was not worth having that yo-yo effect or potential yo-yo effect. We didn't want people gaming it, saying, oh, well, if I don't go, then my town will pay less or something. When you need the services, you need the services. So we, as a board, recommended that the towns adopt the percentages from the latest census, the 2020 census, which are 54% Deerfield, 28% Sunderland, 18% Whately. And when the next census numbers come out, the 2030 census, I think the numbers, you don't really get them until maybe 2 or 3 years later. Then when that happens, then we update those so that if there is a trend, if one of the towns is getting younger instead of getting older, then we have a mechanism in place to update those, but it only updates every 10 years. We did look back from 2020, 2010, 2000, 2010, and 2020. And for any given town, it only changed by less than 1% over 10 years. So even when it does change, it's probably not going to be an earth-shattering change. It might change you from, I don't know, it might change Whately to 19% someday. So that's the process we used. And I think everybody was on board. All of the select boards signed off on that adjustment to our intermunicipal agreement.
Thank you.
Use the
ahead, George.
microphone.
Come up to a mic.
Julie got to recognize you.
Yep, either one.
I'm George Reynolds from the Finance Committee in Whately. I just have a procedural question about the Prop 2.5 issue.
Mm-hmm.
So the $50 number that you put up, that does not include the installation of a kitchen, right?
Correct. That does not, correct.
No.
Yeah.
So we're passing a budget for the building essentially as is.
No, I disagree.
No, let me finish my question.
Okay.
The question is, if we go in later and need a kitchen, is that another 2.5 vote? In other words, how do you pitch the 2.5 vote to make sure you're covering future costs as well?
I don't know that you can. I think when you do it, you can all correct me if I'm wrong, but you have to say what you're spending the money on. So I can't just, let's do a Prop 2.5 so that we have a bigger levy limit.
Yeah, that's
right.
what I don't know.
And we don't actually know what a commercial kitchen will actually cost because we don't know what we'll get in donations. We don't know what we'll get in grants, especially with the nonprofit. They'll be able to apply for grants that we as a municipal entity can't apply for. And we're talking, in that case, you're talking $20,000 to $30,000 in 2026 dollars. That's not very much. When then you divide it among three
Okay.
towns,
I just didn't want.
it's more of like a capital line item that might be a one-time capital item in a budget.
Not necessarily requiring another 2.5.
Yeah.
type thing. Okay.
Yeah, and in my understanding, and I probably shouldn't say it, or else it won't come true. In Whately, we're probably not looking at an override. In Sunderland and Deerfield, I
Yeah,
understand
no, I
you're
didn't
closer
ask really
to.
specifically
Yeah.
about that. It was just in general.
Right.
Thank you.
Like, just to clarify, I guess, you don't specifically have to say what the override is going for. I mean, it's not a definite figure, so you could basically raise it higher than what you are actually looking to spend. However, in order to sell your override, the people are going to want to know what those dollars are going towards. So it's kind of.
Okay.
Tim, go ahead.
Tim Hilchey, Deerfield Select Board. So just to follow up on what these questions were, Sunderland is looking at a substantial deficit. So when you're looking for an override, I would assume you'd be looking for overrides for this project, for schools, for, there might be 7 or 8 items that you need to cover the cost of. So will that make it harder to pass an override, even if the voters who want to support the senior center, and is that going to sink the senior center because you have all these other budgetary issues?
I mean, if you have an answer to that question, please let us know. The short answer is that in my head, and we have to still discuss this as our committees tomorrow. In my head, the general override for everything else is going to be a item of its own, and this item, which is why I was asking about the wording of how it's being done, is going to be separated as a single item. This is, do you guys want this building or not? Yes, great. Here's the money. Good. Move forward. And it should be independent from our other override.
And that makes sense in the context of if it doesn't pass in another town, then you don't want to be on the hook for that.
Also true.
Right.
Beyond that, I would encourage everybody here who cares a lot about the senior center passing to also show up and vote for our override in general. For the same reason that we want to support the senior center, we also want to support our library and our schools and all of our town services.
Yeah.
And so I'm going to take a little second to plug that. Please, please, please. I love seeing so many people here who care so much. Please show up when it comes time to come to town meeting and general election and also vote for these as well. Thank you.
Okay.
So just one final follow-up, since it's been mooted that Deerfield might discuss this at some point. If your voters passed an override for the senior center, but they didn't pass the other override, you would be forced to cut budgets, wouldn't you not? And would you then be able to fund the senior center?
So that is, of course, one of the big questions, which is why there's also a second budget here, which is what happens if it doesn't pass. And, one of the reasons why we requested to have this meeting of all the towns was to kind of have a discussion between the 3 towns of what can we afford, not just what can Sunderland afford. And so, I'm looking at this 31% increase. It feels like a substantial increase still, but I understand there's a lot of drivers having to do with shifting from grants to non-grant funding sources. So in effect, this is still a level services budget, just with a increase in it, which, and again, given to your point, the numbers we're talking about, we're not talking about $250,000 and $500,000 assessment for our town. We're talking about a much smaller percentage. I think our number was 0.46% for Sunderland, something like those lines.
Right.
So there is part of me that struggles with giving a 31% increase even for level services to a department if our override fails in the town and we're asking again for huge cuts to our basic services elsewhere. Unfortunately, given the nature, we don't really have the mechanism to come back and say, sorry, override didn't pass. We don't have the money. And so we have to be able to work into our contingency non-override budget this 33% increase cost or whatever we argue negotiate down to from this dais. But that's sort of why we wanted to be here, was to be able to have that discussion and be able to have conversations between boards of the different towns about this.
Just wanted to
Yeah.
quickly note, yeah, we have someone online with a hand raised. I just wanted to double check. I believe we're talking about doing public comment at the end.
At
Is that
the
correct?
end, yeah.
Yep. So folks online, if you have comments or questions, please save it for the end when we'll have public comment. Thank you.
Unless you're a member of the board.
Right.
Here you go. If you're bored.
Yeah.
Dylan, nice to see you.
Good to see you. Hi, everybody. Dylan Corpita, Sunderland Finance Committee. I guess back to the top, I think great work was done on the building selection. It was really good to see those different options. The one in Sunderland seems like a good idea, so thank you for doing that work and expanding the services as you have over the last number of years. I just wanted to give a little bit of context and then ask a question. So the context, and we've been talking about this, is Sunderland, we are looking at a significant override. And just to like articulate this, if we pass our override, we're going to be reducing services in many or most of our town departments. And so for me, as much as I do want to invest everywhere I can, I just want to set that context as part of this conversation. We do want to do this. It's not that we want to expand some other services more than we want to expand these. We're going to be cutting services, right? So my question is, if we can get through this, if we can pass this, if we can get through the override, how do we think about the future? What does budget growth look like at the senior center beyond this investment, right? And I don't mean a kitchen, that's a capital item. If bigger space means more programming, that means more FTEs, that begins the trajectory where it's a small budget argument falls apart.
So, I'm sorry.
So that's, I guess my question is just thinking ahead. And I know there's no budgets framed out. You're not committing to anything. Things change, needs are going up. How should we as a town think about what the future annual increases might look like on the operating budget after we make this investment?
So I really appreciate that question because that's something we've talked about with the Board of Oversight and as well as a staff. And that's one of the reasons that I had our program coordinator do a cost analysis of where his time and money goes to go in between the different sites. With us being in one space, we would not need to increase staff. We would actually be able to offer more opportunities for volunteers in our community because there would be a station for them to sit at every, like in the space at the reception desk, or staff would rotate. With us being on one building and 3 floors, we would have a walkie-talkie, so we would be able to say, hey, Jen, I need you upstairs. Jen, I need you here. Tom, I need you here. Chris, I need you here. So we would be able to provide more services with the same amount of staff and additional volunteers. I can tell you we've increased volunteer opportunities when we have larger scale events, but right now we have one volunteer who comes in every Monday to greet people, to help set up things and do stuff like that. But because we are in so many multiple locations, we have a hard time getting people for certain things. Now for our like monthly thing, the food truck, we get people who come in just to set up tables, etc. But we would actually be able to keep the same staff. The only increase is COLA that, the Deerfield Personnel Board and Finance Committee approve and Select Board because they're our fiduciary. So whatever they, go with, and that's what we present. But the way our budget is set up here, the only change would potentially be any utilities, which we went on the higher end of the spectrum because we looked at what the previous tenant used, also from information from an Eversource employee, and went on the higher end. I can tell you that our goal is not to hire any additional staff. We're doing really good with the team we have, and we could do an effective job by offering additional programs and classes, consecutively. And then, if we find there's a bigger request, we can add another class for the same thing, at the same location. But I think the biggest piece is that negates that is if we have Chris doing transportation, Tom doing movement class at 8:30 in the morning and he doesn't get back to the office till 10:30. Someone holds down the office and, we rotate that. So it's hard right now because we don't have additional drivers and things like that. And then with our grant partnerships with the PVTA and other entities, we've been able to fill that gap, and that's where we're looking to continue to do. And if we don't have the money, we don't offer the service. But the goal is to keep everybody in one location to be able to offer the same services at no additional staffing.
Increase services in the end.
Yeah, increase services in the end, because then someone would be in the space all the time and we'd be able to have a closed door to provide additional one-on-one if needed.
And you can imagine things like, we'll pick on Tom because he's not here. Okay, he's got to pack everything up. He's got to go over to the Whately Town Hall in time to turn on the heat before the seniors get there. Then get the chairs out of the way, or put the chairs in the way because some of the with some volunteers to help out. And then at the end, they've got to clean up, tidy up, turn off all the everything, and then go back home. Well, if he were doing that same class in a one-stop senior center, he can get that class going. And then while that class is going with the instructor, maybe he can get something else going in another room. And then he can come back and check on that class. And he can have multiple things going on at once. And one person can effectively be overseeing all that.
Yeah, no,
So it just would just increase the efficiency of our current staff so much that we don't anticipate needing more staff in the foreseeable future.
That's great, and I appreciate the efficiencies. I guess, I just think that it's going to be hard to justify budget increases after this moment, beyond the pace at which police or fire or town departments or other folks are going in a long-term trend.
Yeah.
And so that's, because obviously there's more need. Like, we could fund it, as much money as we could put at it, we could fund more services.
Yeah.
That's not the limiting factor. So it can't be, is it good for somebody? Because everything's good for somebody. The question is, how can we do this across all the needs in the community, across elders, across kids, across everybody? And so that's where I wanted to level set here at this moment, so that 2 years from now, when we're talking about this, we can think back and just see if we've accomplished that goal.
Yeah. Thank you.
Thank you.
So actually, Dylan, I have a question for you. If this were just your budget and not three towns' budget, and you were looking at this, so we have two budgets. We have a stay where you are, and we have a move into the new building. The move into the new building is a separate override. If you do the stay where you are budget, would you want to reduce that?
100%.
We are asking, the ask of departments was a 5% reduction from last year's budget, not from their request.
Right.
That's where we are. And again, our issues aren't everybody's issues, but
Right.
asking me where we are, that's where we are.
And to be clear, we don't want to reduce any budgets,
No.
but we do want to
Yeah,
have parity and
yeah.
equity across our departments. And, for better or for worse, our shared employees are our employees, and we want to, do as well for them as we do for our other departments. And
Yeah.
so, yes, I mean, if we were the entire thing, if this was just Sunderland Senior Center, we would be asking them to be making the same cuts we're asking everybody else to.
5%.
But to be clear, given the situation we're in, I'm not here to advocate for reducing the stay where you are budget.
Mhm.
And I think, I agree that this being part of the decision that each of the towns make is the right thing to do, rather than the committees moving this around beforehand. I think this is one of the benefits of having the intermunicipal agreement versus each town on their own.
Okay.
Yeah.
Thanks. Yep. Why don't you go, and then Margaret? I'm sorry, I don't know your name. I'm pointing and saying you. I apologize.
Marsha Martin. This is working. 23A Snowberry Circle.
Are you a member of a finance committee?
I am not.
Okay,
I have to
then
speak
you're going to
now?
have to hold up
Okay.
until we get the finance committees through. I'm sorry, I apologize. Margaret, go for it.
Just two very brief questions. Have we kind of settled on a lease framework anyway at this point?
I would say yes, we have a framework for a lease.
Okay, and how many years is it again?
That is not necessarily settled.
Okay.
The building owner would like it to be a 15-year lease.
Okay.
For us to do that, though, we do need you to put an article on your town meeting warrant that will give your select board the power to enter into a lease that's more than 3 years.
Okay.
We could be as low as 10 years, though. kind of the range we're looking for.
Some of us will still be here in 10 years. I don't know if I will be, but some of us will be here in 10 years. So what do you envision
Well,
for renewal terms?
The other thing too is that I just want to be clear that we still have to go out for an RFP, and while we have a framework, nothing is solidified and nothing is moving forward without that. Yeah, some things. So we would have, after the first 5 years, we would be able to purchase. So if the towns came to an agreement in 5 years, we would have the first right of refusal to purchase the space. And if the towns after, if it's agreed with the select boards to determine and negotiate 10 years and they say, hey, I don't, the towns don't want to do this anymore, we could be, gone. But there's going to be discussions about any early termination, for leasing. It's not a traditional commercial lease, but it does have factors in it that are typical commercial.
Okay, so
leases.
possibly after 5 years, you're looking at right of first refusal that
Yes.
could be presented. What about?
So even more than that, like if we decide after 5 years we want to buy it,
Okay.
we can do that proactively.
Does that option continue throughout the remainder of the lease?
Yes, we can absolutely have that in there.
And what is the annual escalator? I think I remember discussing with
yeah.
2.5%.
Yes, they're 2.5% on the base rent, which is
Okay.
$10,000 a month. The amount of the rent that is the financing of the build to suit portion, that would be constant. And he's giving us a really great rate. He's giving us 5%. Can anybody else get 5% for a loan? Nobody else can get 5%.
Okay.
So he's willing to eat the difference.
Okay.
If he can't get 5%.
And should the towns not decide to purchase the building and instead desire to extend the lease, there'll be lease renewal terms?
Yes, we are planning to have lease renewal terms in there.
Okay, and any sense as to what that would be? I mean, 10 years is a fairly short lease, especially if we plan to invest in commercial kitchen.
No, I absolutely, I hear you.
Yeah.
To get an actual lease with actual legal terms in it, we will have to get actual lawyers to actually do it. And nobody wants to go to that expense before we actually know if we have funding or not.
Okay.
So at this point, all of those things have been taken into consideration. We have a member of Whately's Finance Committee who has commercial real estate experience on this little subcommittee that has been talking with the owner about what the terms of a lease would be. But so you brought up the escalator is just on the base rent. It's not on the money that's needed to fund the renovations.
Okay.
Are there others like specific things? Because we made a little.
Yeah, if you have any additional information, if it's something that would be valuable to share now, I think I'd appreciate hearing it.
Let's see.
I'll sit down because my question.
Okay.
Yeah, my question.
I mean, yeah. There's too many things for me to read this out. So I guess I'd rather not. But I think the important ones are the flexibility on being able to purchase the building if we want to. And like right now, we're not necessarily, and none of the towns are in necessarily a great position to buy a building. However, it could be that 5 years from now, we change the structure of our senior center to be either a consortium or a district, in which case those entities can own property and those entities can own it for the 3 towns. So we may be in a very different position when it comes time to thinking about purchasing in the future. So I think right now leasing is the best option for us. Will it still be the best option in 5 years? I don't know. But we still have the option to keep leasing. And I think last time I talked to the owner, 15 years was what he would prefer, given that we'd be doing these renovations to the building. Is there anything important that I've left out, Jerry? I mean, there's a lot of little points because we brought up a lot of different things like, well, what would the process be for terminating early if catastrophe strikes? What would the process be if someone makes you and we don't have all of those things nailed down, but maybe Jerry, you can remember something that might be important to a finance committee member to know.
No problem. Jerry Lemon, Finance Committee for Whately. I think most of the points have been covered are you're working with a very cooperative landlord, an owner who wants to do well for the community. He's offered, as you said, 15-year lease. Renewals beyond that would like to see us in the building forever. agreed to flexibility in terms of purchasing the real estate, and then specifically to protect both himself and the towns, the ability to terminate the lease if something were to happen that we did not want to fulfill the obligations, simply recovering his capital investment in the building, which makes sense, and perhaps some latitude on the remaining number of years of the lease. So if he were a true landlord, he could say, hey, you signed a 15-year lease. I'm looking for 15 years in my hand. But I don't believe that is this owner. And I'm sure he would give flexibility to the 3 towns and the concept of the senior center to help with that.
That actually raises another question. This is nothing to do with money, so sorry, but the property is actually used quite a bit by Sunderland, different entities in Sunderland, because the owner is so kind and generous. For example, when we were the Little League Baseball did fundraising there by washing their cars in their parking lot. They let us, the town residents, use their hill behind the location for sledding in the winter. In fact, there's a memorial bench at the top, that kind of thing. Not that there was any plan to change any of that, but I just would like to hear a commitment to maintain those.
I think those are really important events that occur in the community. When my son was going through school in the school system where he was in Northampton and in Chicopee, I was a very strong proponent of different fundraisers. And I think that's really important to the community, not to change that. We joked about having seniors who were able to still go sledding if they wanted to go sledding, and I think it's important to still have that space as available as a community space because it is such a centrally located location. I've had my car washed there once or twice over the past 12 years. I think it's important to continue it to be a community hub because in the future, the purpose of a senior center could be a community center at some point. So I am going to be here as long as I'm welcome and have a job here. And I think it's really important to look at the community because that's our goal with the seniors is to have that community and having intergenerational program. We could get the seniors out there washing cars with them. I mean, that's if those folks want to participate, but I think that's really important to continue.
Great, thank you.
A couple of questions. You had mentioned the elevator. Do you have definite word from the Sunderland building inspector that the elevator would meet the requirements? So looking at the code 521 CMR regulation, that's where the exemption is. The interior of the car has been measured. The landlord, and I give him his credit, is doing some of the inspections prior to, but they're not going to do certain things until they get in there. But having that exemption in the mass regulation and the accurate measurement of the cab of the elevator, I think is really gives us that information there. I know for a fact that they've been talking to like the fire department to talk about what certain requirements are there, occupancy, things along those lines. There are no definite answers as to everything. I do not, know what the building inspector thinks. So until we have a signed lease or a signed everything moving forward, I don't think we're going to have all of that information. But it does meet that exemption per code on the mass reg.
We had 2 physicists measure it, so it's measured. It's measured right.
Okay.
Becky, I see your hand up.
Yeah. I have a couple more. Oh, come on up. Go ahead.
Back to the issue on the lease. I'm not sure. We had a little conversation about the lease, and I think, Chris, you think that it only needs to be on the warrant article for Deerfield. Is that right at this point?
Well, I think we have been talking about who needs to actually execute the lease. So at least with their current lease for their 22 Amherst Road, it is just the fiduciary that is the town of Deerfield who is the signatory to that.
Okay.
It is done that way, but I think you know, if we're going to move forward, I think all the towns should give permission to their select board to give Deerfield the permission to do that with the IMA.
I don't know. I think I would defer to the professionals. That you all will, I'm sure, be in touch with council to make sure that what your wording is correct. So.
All right, so I'll reach out to council. And I just wanted to be clear, the reason we needed to move the meeting is we have to have our final override number by Friday. The ballot has to be completed by Friday because we can't change the election date, which is the week after our town meeting on the 2nd of May. Just putting that date out there, May 2nd, Sunderland will be having an override.
So when you presented the numbers for the towns, first off, you guys are doing a fantastic job, and the increase in the people that you've had come to the senior center shows that. Your programming is fantastic. I totally buy into the concept that if you could do everything in one place, you'd be a lot more efficient. So you're up to, I don't know, 20% of the seniors participate at least once a year. So you're reaching people, and it's increasing, and I think that's fantastic. The numbers that you presented for the buildings, when you present the numbers for this building that we're in right now, that renovation was a full up $7 million renovation that infilled this floor. It added some additional bathrooms or something in this end of the bed. It was in a very extensive renovation. It would be possible to come into this building with really minimal renovations. It would not be the perfect senior center, but it would be a very usable senior center, and the space is very, the way the space is laid out, it's amenable to the types of things that you would do in a senior center. You have this huge room here, and then you have essentially classrooms off on the sides that are very large rooms. So there is a possibility that there's another answer to what the senior center could do. Deerfield went after y'all came here and presented the presentation essentially that you gave us a few minutes ago. There were a bunch of questions in it, and so we felt the need to answer those questions, which were what would the rent be if you were to come into this building or to go into the church building, and what else would be in here? The answer to that is very simple. It would be the rec department, the nurse, and you guys for this entire space. I don't feel the need, like we have those numbers. We will come to you and give you those numbers, but there are, I feel like the way this building was portrayed and the dollar value in this building was portrayed doesn't reflect what could be done in this building.
Yeah, we can always do less, right?
Yep.
You can always just say, throw us the keys.
Exactly.
There you go. But my understanding is there's a reason why your town offices are moving out of this building.
And it's because that building is a 2-story building and this building is a 1-story building.
I understand what you're saying, but I also understand that this building needs substantial renovation. We took the numbers that the EDM Studios gave us. They gave something close to $8 million to do up this building, and we said, no, we cut some things out of it and cut it down to $5 million. Maybe it's really $3 million, but it's in the millions, and I don't think any of the numbers you were considering were in the millions to make this a senior center that we can really use. If we're constantly fighting with the AC in the rooms back here, where there's single pane windows are letting in the cold and letting in the heat in the summer, that's just another electric bill. That's just going to be
Yep.
a way out of control electric bill. The building needs substantially more than I think your finance committee thinks. You can, I think our seniors deserve better than that. I think comparing what we have a chance to do for very, very low amounts of money, for $50 increase, okay? If we did that same thing here, we would get nowhere near the quality of a center that we can have at 112 Amherst Road. What if we use the number for 112 Amherst Road? And we estimated probably a little high, that'll be $500,000. Probably it will be less, but $500,000. What if that was the number here? That's not going to pay for new double pane windows. It's not going to pay for overhauling HVAC. It's not going to pay for taking out the number of walls we'd have to take out. It's not going to pay for the number of bathrooms we would need. Maybe Trevor's a little even more familiar with the building than I am. Do you want to comment?
Well, I think there's, it's hard to compare the two spaces. One is kind of ready to kind of move into with minimal work. This one will need some work. It's somewhere in between those numbers, right? It's somewhere in between doing not much to get in here with paint and stuff, and it's a bigger space than we have right now, but it's not really just about space. I mean, you could give us a hockey rink. It doesn't mean it fits the needs, right? It's not the square footage really that matters. It's how you're going to use the space. And we've probably spent well over $100,000 on a needs assessment and then feasibility studies to tell us kind of, or have the community tell us what they're looking for in a senior center and what it could use, how we could function best. And I think neither space is perfect. I do think that we're going to need somewhere in between a just get in here and $5 million. I think the number that we had on the 8 Conway Street is probably inflated, but it really it's somewhere in there. And I think we'd have to do, if none of this passes and Sunderland is in a hard spot, Deerfield's in a hard spot. If it doesn't, we're going to come around to something else. We've got to just keep fighting. I think personally, the 112 space is our best value and would solve the problem for a good many years. And just having our seniors in one spot, as everybody has said, for all the other reasons, will be beneficial. But it is hard to fit it into an operating budget. That's the hard part. So the Prop 2.5 override is really what's going to have to happen in Deerfield. I don't know if it would pass. We haven't done it in many years. So back to the building, it's somewhere in between those numbers. I don't know what it is because we'd have to do a little more work to figure that out. Our focus right now as a Board of Oversight and all the work we've done is to try and get in 112 and see where that goes. And if the townsfolk decide it's not worthy of that, then we'll find another solution. And hopefully it'd be wonderful to have this as an opportunity if nothing else happens. Because I know the landlord's not going to hang on forever. I mean, they've got a beautiful building there and they obviously need to rent it. So.
No, and I guess I would advocate all the people here, you get the government that you pay for. So I understand Sunderland is going to do at least a 5% cut, but my gosh, if you value your government services, why not ask for level services in your override? I mean, maybe there's other reasons that I'm not aware of because I haven't been to all your finance committee meetings, but give people a chance to fund you and give you what you need. Like I said, I
Right,
don't know everything about the negotiations you've done so far.
Any other members of any of the finance committees have comments?
If I can just add
Yeah.
one more.
Yeah, go ahead.
very quick
Go for
comment,
it.
And that is just that I also would like to make sure that everyone knows that this is the end of a many-year process, just trying to find suitable buildings in these 3 towns. I don't even just mean ones for available, just buildings that exist in these towns that fit. And there's like 5 buildings in these 3 towns that will work. And the fact that this one's even available at all to us is a godsend. I remember going to the old one that's up by the Amherst border, and that wasn't a great location. But we were excited about it, but it wasn't a great location because of how few good stock buildings like this exist in these towns. And again, we're at this crossroads of a owner who's willing to work with us and in a building that's actually going to work for our needs.
Go ahead.
Mark Brennan, Deerfield Finance Committee. I just wanted to make a couple comments. The first one, that EDM Studios assessment that was done did kind of make one really big assumption, and that was that this building was going to have a change of use. That's actually not the case. So the cost associated with what EDM Studios came up with in reality would be much less to convert this building. So I'm optimistic if, the Sunderland property doesn't go through, I think we would still have a good alternative. The other thing I wanted to say is I am slightly concerned as like a finance committee member, what happens if we are on the hook for a 10 or a 15-year lease. We're starting to get into big money at this point, almost close to what bond terms would be. And I know that we're not in a position to have a large capital project right now, nor do we have the land for it. But, if we're talking 10, 15 years and we bond out stuff for a 20-year period, I start to question whether or not we should be doing this. But, if the lease is written well enough where, if we've got a right of first refusal and possibly an exit trigger if we do refuse, because the right of first refusal it lets us, have an option to buy, but it doesn't let us out. We still have to,
those are two different issues. that
Yeah,
have
they
to
are.
both be addressed.
So, I would want to make sure that, the select boards, when they enter an agreement, have some sort of, and it's hard to tell, right? Like we don't have the other party here to ask these questions about, but, so that's another thing. And then, the last thing I wanted to kind of ask more for like the other towns' finance committees is, kind of an elephant in the room for the finance committees. We haven't really discussed it at all here, is that we're going to have the Franklin Tech assessment coming up as well. So in the case of Sunderland, you've got your just regular services that you're going to have to do at a 2.5 override for this, and then potentially the debt exclusion vote coming up for that. So I think all of us as finance committee members need to take a look at our town's financial indicators and see, what can we reasonably take on. Thank you.
Any other finance or select board folks have questions or comments? I'm not seeing any. All right, I'm tired, but so we can open this up to public comment. You guys good to stick around for a little bit longer? We can open this up to public comment. If you have a comment, please come up to the mic, tell us your name, where you're from, and keep your remarks short. So 2 minutes or less per person, and I'll be like gonging you. So just get in line and stand up. And I think John Paturik's.
There is someone on Zoom that has their hand up.
Okay, Larry and Phyllis, we have 2 people here, and then we'll go to you online.
Hi, Larry Rivet. I'm sorry.
Yep, hold on.
All right.
We got somebody here first, and then you can go. Hang on. Go ahead, John.
My name's John Pachurik. I'm resident of Deerfield. I live at 50 Sugarloaf Street. I was a selectman in this town for 18 years. I was on the finance committee for about 10 years. I was on the South Deerfield Fire District for about another 13 years, I think. I was a Franklin Regional Council of Government member. And I'd like to say that, first of all, you did a great presentation, but I find that some of the numbers that you're using are very inaccurate. For example, when you say the renovation cost is $5 million, they're trying to get us into a building in Sunderland that's a Taj Mahal, 10,500 square feet. You got 1,800 square feet now, 5 times as big. You're doing a great job running the programs now, but you don't need 10,500 square feet. There are alternatives that are available. For example, you've got the Congregational Church, and you said there was mold in the building. Well, guess what? When I walked through the building at 122, they had powder sprinkled on the floor. Usually that's an indication they're trying to hide the mold or must that's in the building. You say you can't get the operational cost for this building. All you gotta do is call our town accountant. She can tell you what the costs are for a year. So when you turn around and say some stuff's not available, and yet you're saying it's gonna cost $5 million to renovate this, why do you have to fill this in? You got a handicap ramp there. You got all these offices, you don't have to do nothing other than maybe a little painting or maybe sweep it clean, and that's it. You don't have to do what you're telling us that you have to do. You just want it. There's a difference between a want and a need. A want is a grandiose game that you can play saying, I want this and I want that and I want everything. But guess what? You don't need it because you don't have it now, and that proves you don't need it because you're doing everything you can now with basically nothing. But I'm against the building in Sunderland. And the reason I'm against the building in Sunderland is because, first of all, you're investing in a private building. Part of the rent incorporates $500,000 of renovation. So you're going to renovate and put $500,000 into a private building. And when you get through with a lease of 10, 15, or 20 years, you got zero equity, not a cent. There seems to be a problem where you're concerned about not having a town-owned building. Well, what's wrong with a town-owned building? When they were in 88, in the 1888 building, from the lease that I saw, they charged $1 for the first month's rent, and then it was free for 30 years. So what's wrong with a town building? We don't have to pay taxes. Right now, you want us to pay taxes to the town of Deerfield, and then ship the tax over to the town of Sunderland. For what? This is probably one of the worst deals I've seen so far in my career of public service. My career only goes back 30 years, so I don't have the 80 years I'm showing my age. But the bottom line is, I don't think this is a good deal for the town of Deerfield.
Thank you, John.
For the future,
John, you're done.
Yeah.
I'd like to tell you that you have options. The options are simple. You can go over to this place right over here, Congregational Church, or you can come in here with very little and nothing over there. Thank you.
All right. Thank you,
John.
John. Julie, you're up.
Julie Cavaco from North Hillside Road, Deerfield. I'm here to say that I would love to see this go to all the townspeople in a vote. I understand the override issues, but I know that Deerfield has been jumping up and down over needing to service our seniors and many discussions over the years. And so I know it's important that we get a good senior center for them. I was at the walkthrough today, and what I see in that space is incorporating the growth that we've had. In the last 6 years, we've gone from X amount of people exponentially, so many more are going. If you have a good space, it will service more people. If we end up moving here, which I wasn't going to mention, if we end up moving here, you're going to have less people. There's not parking, there's not as many activities. And so I think that Jen has done a really good job with her team in growing everything and really fitting all the, all the needs of the population. And I would like the population to be able to weigh in on this. I think that's the most important thing because a lot of people are not here. And I think that if we leave it down to just the people that need to vote on whether it goes through, that's really unfair to the seniors. So thank you for your time.
Thank you. Jeff, hang on. We're going to go to Larry online, and then Larry, go ahead.
Hi, Larry Rivet from Sunderland. One of the things I want to talk about is the value of the proposed property beyond the seniors, and I'm a senior, but the value that it has to all three communities. You can look at it in terms of that new word, resilience. Everyone is talking about dealing with resilience. How do towns face the prospects of catastrophes from climate change, from other problems? We need, in emergencies, we need warming centers, we need cooling centers. There are other types of emergencies where we need places that people can go and be safe if they need to. That's an expense that communities have to face. This property can service, it's got an HVAC system built in, it's got a power generator built in, ready to go, and it's there and it's available
Full building.
for the whole building. And it's available sort of as part of the deal. And I think we should be aware of the value that that brings to our communities.
All right. Thank you, Larry. Jeff?
Jeff Upton, 3 Hillcrest Ave, South Deerfield, Mass. And very quickly, I have just a list here to go through, and I'll do it as quickly as possible. Current asking price of the building in Sunderland.
Yeah, they don't have an offer from anyone. The assessed value is 1.2 million.
Okay, so 1.2 million.
That's the assessed. I don't know what it
Right,
would get
yeah,
on. I don't know what
that's
the, sorry, that's
Yep,
the
that's fine.
assessed.
Costs of renovations.
It's
that
going to
we
be
need to
between
do.
$300,000 and $500,000.
Okay, between 300 and 500. All right.
Yep.
Cost per month or year for the rent. Now, I'm not talking about
Yeah.
the budget, operating budget. I'm talking about just rent.
The base rent is $10,000 a month. If we are on the high end of if it really takes a $500,000, then that's an extra roughly $4,000 per month. 53 on,
So roughly
30.
about $120,000 a year?
something like, yeah.
Okay.
Yeah.
So if you do a 10-year lease, how much is that going to be for total for $120,000 a year?
I'll get my calculator out.
1.3.
1.2 million.
It's 168,000.
1.2 million?
Yeah.
Correct.
No.
$1.2 million for rent.
Yeah.
If it's an 15-year lease, it's $1.8 million for rent. Plus, we have between 300,000 and 500,000 in renovations for the
Well,
building.
that's included in the rent.
Okay.
that's not a plus.
Well, that's why I was wondering if it was separate costs. So you're either between 1.2 million or 1.8 million. Assessed value is 1.2 million.
Yep.
So if we walk away at the end of 10 years or 15 years, we've spent on rent 1.2 million or 1.8 million, and we have nothing. All 3 towns, we have nothing.
Yeah.
It served in that for rent for those years as a stopgap, but that's a pretty expensive stopgap. And before I go any further, I support the seniors in what you're doing. And Jennifer and your staff, you're great. I've seen you work with the seniors. Excellent. But the finance part of this is bothering me a little bit. We also have a 2.5% escalator per year as far as the rent. Well, if you're,
On just the base rent.
pardon?
On just the base rent.
Right,
not
but
on
the base rent.
Not on the
But even with
finance and
that,
renovations.
that adds up after 10 years or 15 years. So then my last, just want to make sure here. I guess my question is this or is this not going to be a permanent home? If it's not going to be a permanent home, should we be taking this on?
I think it's more permanent than I've seen in the last 10 years of serving on the board, right? So there hasn't been another space that's been as ready to move into and as affordable and all of that. We've looked for land, we've looked for buildings, we looked for all this stuff. I think what you're getting at is why don't we just buy the place?
Well,
But we don't have an entity at this moment to purchase it. Sunderland's not in a position. Deerfield's not going to buy a building, not in Deerfield. Whately's not going to do the same. I think a lease to own, and I think the owners are amenable to that. So I think get in and start leasing it, renegotiate the lease to own if we can get an entity to purchase it. Because I think long term, you're talking $1.3 million in 10 years, you could own the building, right?
That's
not
what
generally how it works.
That's my point.
Yeah.
If I believe Mr. Warner owns the building.
Correct.
If he wanted to act as a banker.
Correct.
And the rent that we paid went to the principal to own it.
Or a portion of.
Right, that might be a different story.
Yeah.
Right now, that's an awful big ask for rent where you walk away 10 years or 15 years and have nothing. One last question.
And I think he's open to that, but
Right.
that's to be negotiated.
Well, that's something that needs to be considered. I think it'd be an easier sell to all 3 towns if they knew they were going to own something at the end of this expense. One last thing. You had mentioned that the Volvo building.
The what building?
The Volvo building
The
down
Volvo,
here on
yeah.
5 and 10.
Yeah.
I checked mileage from here to the Volvo building into Sunderland building. Mileage is almost exactly the same. Minutes are almost exactly the same. I do have a little bit of a building background, and not to take something off the tax roll in Deerfield, because we have this building that's being talked about, and we have the church. We own enough property, as far as I'm concerned, in Deerfield, and not really having a use for it. But that Volvo building, I looked at that, and that Volvo building is in pretty good shape. And it's on water, it's gas, and I called. They have a 2,500 gallon septic tank. I believe it was called a 1E EPA clearance on that septic tank, and that's why it's for sale, which means it's perfectly clean. So the septic system is good. So I think you referred to, and believe me, this is not personal. You referred to, I'm trying to use I think of the term that.
Yeah, you're
wasn't
approaching your
feasible.
2 minutes.
Yeah.
It wasn't
wrap it up.
feasible. Well, this is it.
Well, I would turn that over to somebody who's more familiar with the building. You want to answer that?
I'm just wondering why it wasn't feasible. Because that's listing at 1.625. You could probably pick it up for 1.4, own it, and have almost a move in place for the seniors. Think about it.
If I could just add a couple of quick pieces of context, and one of those is that if we were to buy the building, we'd also be financing it. So the 1.2 million or whatever cost would be more like 60–80% more than that over the term for the cost. So there is a cost there. And one of the other things that we're trying to figure out here is making sure that we get into the right building and not locking ourselves into the wrong building. So if we were to go ahead and buy that building and discover within the first couple of years that for whatever reason it does not work for us, we own it and we have no choices. The idea here is that we are able to start renting it, make sure it works for the town, make sure that it's a good fit for the residents, make sure it's a good fit for the services in the senior center, with that 5-year option of being able to buy it, to your point, to be able to be more fiscally responsible if it is a good permanent home. But also there've been a lot of conversations, at least in Sunderland, about the pitfalls of any given town becoming the landlord for a multi-town organization. Sunderland does not want to enter into that. We don't want to be landlords. There's cost involved in being landlords and all that stuff. And there's also from anybody owning versus renting. If you rent, you don't have the liability of owning the building. So anyways.
Yeah, I think that what I would say is that there are advantages to leasing and there are advantages to owning. And with ownership, everybody knows about home ownership and equity, but you've also heard that your home can also be a money pit. So when you own it, you got to fix it. You got to maintain it. And when something breaks, you got to fix it. That's one of the things that's an advantage of leasing, is that when the HVAC breaks, that's their expense. Okay. And that's what we're buying with the rent.
Tom, you're up.
I'm just going to say something real short. Been around a long time, and I know there's one person that's extremely happy to see all of the people that showed up here right now, and that woman's name is Shirley Pelock. And if people understood who Shirley Pelock was, she ran the senior center prior to really being a senior center. In my first Board of Selectmen meeting, Shirley was there. And Shirley worked with a budget that most of it came out of her own personal pocket. And she would go to the boards of selectmen of the 3 towns. I don't know how she ever made it through Deerfield. But she went and see, I know he has a heart. And he did. And she came out and she did everything by herself. And that's how the senior center started. And I know if she was here today and saw the support, both good and bad, on both sides of the conversation, she'd be the first person that would have the biggest smile on her face. So I just wanted to thank Shirley Pelock for many years ago for starting the South Frontier, whatever we called it back then. And also, one other thing, John, this floor you're standing on is asbestos. So I hope you figure out how much it's gonna cost to get rid of that.
But it's not friable. Anybody else, any other comment? Oh, come on up.
My name is Doris Bardwell. I live on 10A Snowberry
A
Circle.
little closer, a
Oh.
little closer.
My name is Doris Bardwell, and I live on 10A Snowberry Circle. I have a prepared statement. We need a new, larger senior center that will support the aging populations of all three of our towns sooner rather than later, so it can be enjoyed now by some of the same seniors who have been patiently moved from one temporary location to another, including under a tent. I listened to the members from each town at the forum who spoke from their hearts, and it says a lot to me that they remained active even through the chaos of moving so many times. It illustrates to me how important the center is in their lives to meet their needs to socialize with friends, attend fitness classes, cultural events, and travel together on field trips, followed by a stop for lunch. Breaking bread with friends nourishes the heart and soul throughout our entire lives, including old age. As we grow older, we start losing spouses, beloved family members, and dear friends. But our need for close relationships and community continues if we are to thrive. Too many seniors suffer loneliness, isolation, depression, food insecurity, and struggle financially and physically to remain independent and healthy. Some are utterly alone. A vibrant new center can become a catalyst to encourage more elderly to join and share in community. We must do better to help more seniors. I believe the need is dire at this time. We already know that the current center has serious limitations for space, parking, and privacy. Parking is a major issue. I had to forego attending an event once because I couldn't find a space to park. And on more than one occasion, my husband and I missed attending an event because it was filled due to limited space, and we were put on a waiting list. The center must close once a week to allow the staff to meet privately, one-on-one with clients to assist them with very important personal, insurance, or financial conversations because there is no private space. The new center will offer multiple private rooms to be better able to serve this important function. Bringing all three towns under one indoor tent in a safe setting will allow for multiple concurrent events to be occurring simultaneously. It can be a brand new beginning for all three towns to join together, form new friendships, and share in community. I toured the proposed new location in Sunderland twice, including today, and attended one of the forums to learn the details. It appears to me that 112 Amherst Road makes the most logical and common sense because it has the size needed as our aging population grows. It has ample parking with room for more spaces. It has lovely grounds that may even open up opportunities for bringing some activities outdoors on sunny days, such as gardening, meditation, yoga, card games, and it will be ready for use sooner rather than later. I don't want my taxes to go up either. We just had an increase in our community of 39% for all of us. But we already do pay a tax for the senior center, and the difference between what we'd be paying to stay where we are or to move to this new location seems worth it to me for what we will be getting in return. I will be carefully listening to all of you and all of this from the Finance Committee and Select Board conversations as we move ahead with this decision. Seniors have approved budgets to pay for everything: schools, sports, libraries, and town services our whole lives. We have paid and paid and paid. It seems that the budget request for this new center is meager in comparison to some of the other much larger line items. I think Deerfield should approve our share of the budget for this center. It will provide for the well-being of senior citizens now and for future generations in maintaining a healthy, joyful, dignified quality of life. Thank you.
Hello, I'm Larry Kleinschmidt. I live over near the mountain on King Philip. My wife wrote this. She's Nikki Stoya. She's playing piano at a UMass recital tonight, and she couldn't be here. so I'm going to try to get through this quickly. She likes to write long letters.
2 minutes, yeah.
Yeah, get the hook out.
It's big letters. Might not be-
First, she starts out saying, I welcome the opportunity to speak for the new senior center, the 12 Sunderland Road. Closer?
There you go. Yeah.
Okay, how's that?
That's
Is that
better.
better? Okay. She says, I've lived in Sunderland and Deerfield over 32 years, and now we're living in next to the mountain there. And she's paid taxes, and so have I, over all those years. And in all those years, we have paid for all the infrastructure, all the college, all the school improvements, and all the stuff that it takes to run a town, okay? We never had children in our school system. My kids were older when I met Nikki, so our kids were all beyond the school age. We still paid all the taxes. They all have to be paid to have a reasonable town to live in, okay? So we believe that right now, the segment of the populations that we should be serving as a town is youth, young and middle-aged adults, and seniors, okay? We've supported all the other goings on and all the taxes that have been paid for over the last 30 years. Many of the seniors even more than 30 years. Some of the seniors in this group are Vietnam veterans, okay? They paid with blood for what they get, okay? And quite frankly, they're used to being ignored. We've been ignored before. Okay. She points out that the senior center is used by people 55 and up, and many of the items are open for other people, not just 55 and up, but for other people in the community. She also mentions that she does the 3-day-a-week enhanced fitness, cardio and weights, and she does yoga. And that at 68 years old, which is what she's at right now, she needs to have good health and be in good shape because she runs a lot of outside interests in her retirement. She calls it a retirement, okay? She's the Springfield Symphony Chorus conductor. She has a post-retirement in music. She does all sorts of recitals with the kids that she's still training down there. So it's important to her, okay? And in closing, she just says she's blown away, and we were both blown away by the well-maintained, beautiful facility that's over there. And we would certainly like to have it. It has most everything we need. In addition, it has sufficient parking. No chances that everybody's going to have to cross a street to get to where they need to go. And everybody can do their programs in one building and cut down on a lot of running around cost, okay? Funding for this senior center should not be considered giving a gift to the seniors. The seniors have earned what they get, okay? This is no way any different than funding the other important areas that we fund in our town, like schools and infrastructure and streets and such and such. So, in closing, I would just say, me and my wife support the senior center. And she picked up a saying from me. She says she would like to have it before she dropped dead.
All right, come on up.
Hi, everybody. I know it's late and we're all getting pretty tired, but I just wrote a little bit something to give you my thoughts. Expanding the senior center is a thoughtful and necessary step to better serve our aging population, the one right now and the one to come. Consolidating the services into one facility will significantly improve the efficiency. We know that these guys run around like crazy. They could definitely be more efficient in one location, making it easier for both the staff and for participants to access programs, coordinate resources, and build a stronger sense of community. And that's what we're really all about in this whole process, is trying to build a stronger sense of community for everyone. The expanded space will also allow for hopefully a broader range of programming, ensuring that we can meet the diverse interests and the needs of today's seniors and those going forward. From the fitness programs, the wellness programs, educational programs, social creative opportunities, and growth in the programming means greater engagement. And for me, that means better quality of life. We all could stand for a little bit of improvement in that. I have 25 years plus in the professional experience working with older adults, and I've seen firsthand how vital senior centers are in supporting overall well-being of the seniors. Maintaining and improving physical health is key to helping individuals to age in place and remain independent in their own homes. Equally important is the mental health of our seniors, older adults, reducing the isolation, as many have spoke about, especially for the ones who are living alone. This actually can have a very profound impact on the longevity of our seniors and their overall happiness. Finally, our senior centers play a meaningful role in supporting the spiritual well-being, offering connection, which is huge, purpose, which we all would love to have, and reflection as individuals move through their later stages in life. We could use that support. The 112 building, in my opinion, stands out as the most practical option at this moment in time. It offers the space needed for the expansion, it's cost-effective, and it provides adequate parking, which has been an issue in all of the other locations. As we may not have an opportunity like this for a very, very long time, I would ask you please to consider this possibility, as the 112 building, again, seems to be the most likely practical option at this time. And finally, investing in an expanded senior center is ultimately an investment in the health, in the independence, and especially in the dignity of our community's older adults, both now and in the future. I believe our seniors deserve this, and I sincerely hope you consider everything that was said tonight. Thank you.
Thank you. I would like to ask that as additional people come up, if you don't have something new to say beyond like the senior center's fantastic, come up and talk by all means, but maybe not read the entire thing. Maybe just tell us, yes, you support the new building, or no, you do not support the new building, and just a couple bullets why.
Okay, I will just say that looking at this.
Start with who you are and where you're from.
I'm Mary Ann Sadowski, and I'm from Whately. And if you look at around the surrounding towns, Northampton provided a building for their senior centers. Then if you cross the Connecticut River into Hadley constructed a new building for its seniors. Now, travel north to Greenfield, likewise, they constructed a new building for their senior members, and so did in Irving. We have 3 towns supporting and funding this senior center, and we have been asking for years for one location where everything could take place under one roof. I think we have been overlooked long enough. I think it's our turn to be considered priority rather than always being pushed out the bottom of the ladder. And that's all I'll say.
And that was new and different from what else we heard. So good job. Anybody else? Any other comments?
Joe on the TV or the.
Oh, there's somebody online. Go ahead, Joe.
Yes, I'm speaking as a resident, not finance committee right now. And this hasn't been mentioned, I don't think, directly. But I am embarrassed. I know Jen and Tom and Chris have done a wonderful job with the facility they have. But it's somewhat embarrassing walking into that tight building. It's not very accessible. If you need a ramp, you have to go around back and come through the kitchen. Jen's office and Tom's office is not very private. We talked about that already. I just would like to be proud of a facility for our seniors in our area. Thank you.
Yeah. All right. Come on up.
Thank you. I'm Nat Fortune, 152 Westbrook Road. I'm married to one of the 2 people that gave a fantastic presentation, for which I have a totally objective opinion. I am currently, and have been for the last 6 years, the moderator for the town of Whately. I have served 12 years in a variety of positions on the school committees, elementary, the high school, the Frontier Regional, the Collaborative for Education. I've served for 12 years on Energy Committee, and I have to say this, and I'm only now turning 65 in a month, but it is already past my bedtime. Year after year after year, I have been amazed to see the seniors step up for my town and for yours. Year after year, getting 0.5% or less of the budget, whereas they now are approaching 1/3 of the population, hanging on with whatever scraps we were willing to give them, and think they should be grateful for it. I am amazed that they have stepped forward, override, no override, vote for everything except themselves, for the schools, for the library, for the roads, for the police. And I think we owe the seniors a gratitude to understand that it's not everyone for themselves, that it's a community for the community, investing in each other, including the future, our children. And that now it is time to be able to say, after year and year and year, and that's my 2 minutes, I recognize it. Yeah, of stepping up for everyone else in our towns, that we can't afford to double their budget from 0.5% of our town's budget to 1% for the 37% of this town that needs this here, and say thank you. We are glad to do it. I respectfully ask the finance committees and the select boards of all 3 towns, and believe me, having tried to point people to finance committee and keep them on, for working for absolutely no pay whatsoever to protect the town's future, also help protect the future of our seniors, and recommend positively the budget for this program as finance committees and as select board members to put before the town, to let them decide in the most fantastic form of government we have, New England Town Meeting. Thank you very much.
Thank you.
My name is Paul Newland. I live at 148 Conway Road in West Whately. I have a 1-minute comment, but first I need one figure. How much, Joyce, would we be spending as a town per year?
Jen can get that. The total.
With the GO budget for the 112 Amherst Road Whately's portion would be 18%, $81,228. That's including the current budget and then the increase. And if a no-go vote, Whately's portion would be $46,811.
With a no-go.
With a no-go, if we were to remain at our location at 22 Amherst Road, our current space, that's what Whately would pay. If we went to 112 Amherst Road, it would be $81,228.
Well, I was going to say at first, I thought the number was a little lower than that. So I have to modify what I was going to say, because I was going to say, it turns out that what we're spending is about equivalent to a decent used car per year. And I think our seniors are worth a new car per year. And I think that's a small price to pay for a big benefit. That's all I have to say.
Thank you.
And just to add some context for that, for Sunderland, for a $450,000 house, the difference between the two budgets is $37 a year or 10 cents a day, just for context of what we're talking about there.
Yeah, but you don't tell your kids to budget 10 cents a day. Anybody else have a comment? We might be done. I would like a motion to adjourn the Deerfield Finance Committee. Do we have a second? All those in favor? That's unanimous. All right.
Same for Deerfield Select Board. All those in favor? Aye.
Same for Sunderland Finance Committee.
Aye, Joel Elias.
Oh,
I would entertain a motion for the Sunderland Select Board to adjourn.
Dan had his big up.
Hold up.
Yeah.
Go, Dan.
We still, I'm sorry, I had some trouble with the mic earlier. I kept fading in and out, but the newest member of the board oversight, demographics alone makes sense for this.
Sorry, I can't hear you, Dan. There's a lot of noise.
I'm sorry. Can you hear me now? Can you hear me? I love how the towns work together. My kids went to Frontier, and I love that the four towns support that school. And I hope the three towns will support this senior center. Thank you.
Thank you, Dan.
Thank you, Dan. Dan, do you have a second to adjourn the select board?
Yeah, sorry, I'll adjourn. Thank you.
All right. All those in favor of adjourning the select board? Aye, Nathaniel Waring.
All right, Dan.
Thank you. All right, 3-0. Thank you.
I'll entertain a motion to adjourn the Whately Finance Committee. And we have a second. All those in favor? It passed.
I'd accept a motion to adjourn the Whately Select Board. I'll second. All those in favor?
Aye.
Aye. I think we're done.
I think it's when we have, when we have, no,
Very well run. Have a great night, everyone.
Thank you.
I grew up in,
That's what I'm just gonna say. Right.